says 21 people are watching this. Wait, is that watching right now? Or
Yeah.
are they like your...
Yeah.
Oh!
And now we're live.
Yeah,
Hello.
They're watching the whole screen, but now we're live. Okay. Hello. Hello, everyone.
Whoa.
Hello.
Yeah, you should be able to see yourself on the actual Twitch stream too.
Yeah, with just enough of a delay to be very distracting.
Okay. I was like, am I fucking this up? Okay, yes.
No, you're good.
I'm delayed. I can see myself. Ooh.
Yes.
Hello. Thank you for
Welcome.
waiting, everybody. We had some technical difficulties, and now we're here.
Yes, we're here.
So just we're gonna address the elephant in the room right away.
This is getting out of hand. Now there are two of them.
Oh my God. You made that just for...
It took like 5 seconds.
Oh
That's
my
incredible.
God.
But I do have a button that so I could just do it whenever.
This is getting out of hand. Now there are two of them.
So anytime there's two of something from now on, we
Yeah.
can do that.
I'm running out of
We
slots.
do say that a lot.
Yeah, we do.
Two of them.
Oh my God, that's hilarious. I love that.
This is why we pay her the big bucks.
Yeah, for real.
everybody.
And I also
This is why.
I didn't make a button, but I did put this oh wait. Oh yeah, you can see it on the
Oh my God.
two of them. Two of them.
Stop.
So why are there two of them? How did you all meet even?
Well, it all comes down to that I didn't check my Google ability before changing my name, transition-wise, which was a good thing, because otherwise I probably would have been like, well, I don't want to fuck up two people's inboxes by there being two social psychologists with the exact same credentials, with the exact same name. But I didn't. And so then one day some tech bro got some of Devon got some of my emails from some awful tech bro trying to book a gig, and she reached out to me and was like, hey, I think this email's for you. And then we finally talked about the fact that we both existed
and have so many similar like qualifications, right? You're both do you both have degrees in social psychology, or is it different? Is yours... That's so weird. That's so strange.
Mm-hmm.
It's extremely fucking weird. And also, like, the additional context was this is 2018. This happened. So this was like right when I started my postdoc at Hunter College after UConn. And Devon, I think you just... Laziness Does Not Exist. The essay had just like popped off on Medium that year.
Wow.
And so I would never have even really known Devon existed if it wasn't for the essay going viral, because then when people would Google the name Devon Price, PhD, and probably social psychology or something like that, I don't think you mentioned that in the essay or something, I would come up just because I had existed on like the UConn student website the whole time. And so people kept emailing me. But then the problem was that I lost access to that UConn email account because I wasn't a student anymore, and they like immediately got rid of it. And so I was in this like ridiculous fucking conundrum where I kept getting emails to like interview Devon or like talk like opportunities for Devon. It wasn't just that dude, it was like multiple people, but I couldn't respond to them. Like it would just be like, hey, someone emailed this old ass email that you can't use anymore. And so I was like, what the fuck is this essay? Like, Laziness Does Not Exist. That's like a spicy title and I'm into it. Who is this person with my name? And so I like looked it up and I read the essay and I was like, oh, I really fuck with this. Like, wow, cool. This person has my name and degree. Like, I was just like, cool. Like, I think I would probably like this person and like want to make sure that he's getting, you know, whatever opportunities that I am being emailed about.
Right.
So I don't know how did I find you on Instagram? Is that how I found you?
Yeah. You messaged me on Instagram and was like, "Hey, I don't know," and it was like, it was that stupid guy was like the particular like thing, like some business
Yes.
bro. And it was like it was like, I don't know if you want that, like, just so you know, I'm getting this email, and you like forwarded it to me, and I was like, yeah, and then I just told you like, oh, this guy seems really smarmy, and you were like, yeah, I didn't really know about it, but like figured let you decide, like, and then yeah, I don't know, it was just such a relief that it was like, okay, if for the rest of time someone else is gonna get emails for me, like, and vice versa, it's such a relief that this person is cool. Like,
No, it would have really sucked if I was like, the funny part is that there are a lot of people who are like pretty like, what is the word, like white liberal in
mhm,
social psych in particular, who would like not
mhm,
fuck with a lot of the stuff that Devin talks about. Like a lot of them I feel like would be like fundamentally offended by like the main thesis of laziness does not exist and stuff. Like a lot of them would
mhm.
Yeah.
not fuck with that.
Yeah.
It's wild.
And so it just
It's so wild that you guys both have the same degree and then also are in this smaller niche of like, but and also fuck academia and like fuck all of this other shit.
Mhm.
Like it's
Yeah.
insane to me that y'all have like seem to have like really similar like kind of worldviews about that shit, because that is like a niche and a niche and a niche. It's great.
it's
Yeah.
kind of ridiculous. It feels very much like a divine intervention of such because it was like I don't know, what the fuck. Like,
Yeah. Yeah, and it's like totally like I like so many things had to happen for this to fall in place. I had to change my last name at 18 to what I changed it to. I had to change my first name to what I changed it to. Same spelling, which,
Yeah.
I thought about but not that much, like it's just really funny. Um
that's the thing that fucked me up too was you didn't just at first like I thought you had just changed your first name. The fact that you changed both is just like the most insane thing of all time.
yeah, it's
What a
so weird.
ridiculous. Wow. But yes, that's our origin story. I'm very grateful to have connected because normally I'm just like, I'll be like stoned as hell at like 9 p.m. and be like, Devin, I need to complain about stuff and like send him like 20 voice messages while I his shit.
It's
Like,
so good.
and then eventually, like, I don't know, in like 2 days from that event, I'll see the topic become a really well thought out Medium post.
Yeah, yeah,
It's
literally.
awesome.
And that like and that transitions to the drugs topic so perfectly, because like, yeah, you're like stoned ass, like 20 voicemails, like, that usually about something that's pissing you off, and then I'll be like,
Yes.
that pisses me off too.
Yeah.
Starts
It's honestly like one of the most like reciprocally pleasurable things I think about our relationship because I have no desire to necessarily like really think out coherent thoughts in like a medium. I just want to like bitch about stuff to somebody, especially. And so Devin's like the perfect person to bitch to because he's normally like, yeah, you're right. And here's a 50 other like analyses of like the thing you're mad about. And then like there's a really well articulated essay that comes out of it. And I love reading it. It's like, oh yeah, I feel like he helps me figure my thoughts out.
Have
It's
you guys
ridiculous.
both published stuff, like had stuff like actually published in journals?
mm-hmm.
Together?
Well, just in
Not
general,
together,
like,
but
so that, yeah, that was what I was gonna say. Could you guys please publish something in a journal together? Like, I don't even care what it is. I just want it, like, I want like
Devin Price
Dr.
and
Devon
Devin
Price
Price.
and Dr. Devon Price, and just to
We
fuck
both
with
get
every.
first author.
Yeah. No, I actually, Maddie, I love that you said that because I'm not even kidding you. The other night I texted Devin this exact question.
Yeah,
Yes.
yeah, we're
Like,
big things coming. Big things coming. Watch this space.
yeah,
Yeah.
I had
Yeah,
it.
but
Watch this space.
yeah.
Yeah, but yes, both of us are published in peer-reviewed journals too.
Yes, though Devin is
That's
much
more
more
my lane.
active. Yes, yeah, Devin is much more active in this than I am, and maybe just for the viewers, maybe giving people a little just quick. I mean, I know fuck work and everything, but a quick overview of like what you do, because it's very relevant to the stuff
Yes.
we're talking about today.
Yes, fuck work. But I was just having this conversation with someone recently, and I was like, I see all the like, the anti-capitalist memes and stuff that are like, "What's a dream job? I don't dream of labor," and all this other stuff. I'm like, yeah, I fuck with that. But at the same time, I am actually like really passionate about what I do, and I'm actually very grateful that like, um, for all of human history, we had to do labor in some form until we survived.
I
Want
We
to do
didn't
things
just
that are
like,
meaningful with their life,
but
you
you
know? Like,
right,
yeah.
right.
right. You don't want to do labor that's just like lining the pockets of like some shareholders or something. And so I'm very fortunate and grateful that so I am now working for the New York City Department of Health in the HIV prevention unit and also doing cross collaborations with sexual health clinics and STI, Bureau of STI, and essentially like when I was doing my PhD in social psych, a lot of the stuff I was interested in was specifically about like stigma related to accessing sexual health services and sort of really look not just like looking at the epidemiology of STIs and things like that, but actually honing in on the psychology of like shame in relationship to sexual health. And for me, I started learning all this stuff about social psychology and then seeing the like very real world applications to sexual health care. And I was at one of the few programs ever that actually combines psychology with public health, like intentionally so. So I
Mm.
was put on this NIH grant that was specifically trying to train social psychologists in HIV work. And from there learned really quickly there's quite a bit of tension trying to do stuff the way I wanted to do. And
Yeah.
really instead of just kind of like sorry,
You're
I'm
good.
on a phone. Instead of sort of just like playing into the typical like what was absolutely going to get published and funded. For me, I was like, what if we rethink sexual health care to be pleasurable instead of scary? Like
Mm-hmm.
Seriously.
trying to, yeah. So that's like most of what I do now is I try to apply that framework to the work I do in the Department of Health and like try to essentially create data sets and create stories with surveillance data to tell the story that we should be creating policy that makes people feel empowered by sexual health and like feel yeah, like sexual health can be pleasurable. I think there's nothing hotter than having someone you want to have sex with like go get tested with like together and both get your results and shit and like I don't know. I think that's really hot. Someone would be like, hell yeah, let's like really make sure we can have raw sex in the most pleasurable way, which includes not having all the anxiety, in your
Right.
head about like, oh fuck, like here's all these risks. Because for so long it's
Mm-hmm.
been about risk and not about pleasure. And so that's what I've been trying to do is like really try to shift this narrative away from like shame-based sexual health. Like if you fuck up one time and don't wear a condom and get an STI, you're a horrible, dirty person. Instead of that, really shifting to like it'd be really pleasurable to like go get tested with a partner and like kind of learn your statuses together and like take back that health. Like it's great not to have an untreat like a asymptomatic STI, for example. Like a lot of people have them and have no idea.
Yeah.
And it's fine. Like a lot
Yeah.
like I had fucking bacterial vaginosis for who knows long until I went to get a pap and they're like, just so you know, you have this. I didn't have any symptoms, but
Mm.
like it was important to get that known just so I could like, I didn't have my immune system being low key, like fighting off this infection the whole time. But whatever. The whole point is that's what I do. I do a lot of how can we reframe sexual health to be pleasurable and not shame based.
Right.
That's
Yeah.
great.
Because, like, from both a pleasure and a public health perspective, when people feel afraid, they shut down and they can't take in new information. And this
Yeah.
is probably
Yeah.
what the article that we're gonna like work on potentially together is all about: is how shame makes it really difficult for people to make whatever you want to call healthy decisions. Which, when we talk about harm reduction, that's a whole conversation. Defining what a healty decision is and trying to
Right.
force that
Right.
on people is a whole other conversation worthy of questioning. But like it's really hard for people to think through what they want to do and to consume information about what's, a benefit, what's a risk, when they are freaked out or when they feel judged. And it's also really hard to fucking nut
Yes. Yes,
when you feel
one of
like shit.
these papers that I like, peer-reviewed papers are like hell to get out because it's just such a long fucking process. I was literally just telling Devin about this paper that I worked on way back in like 2015, 2016 in grad school, and I see someone talking about the way anxiety really, really, really relates to sexual pleasure. And like the paper that I produced was about it studied people who were taking PrEP, pre-exposure prophylaxis, which prevents HIV in the same way like a hormonal birth control would prevent pregnancy. And we basically followed their general anxiety levels and then their worry about HIV over the course of a year and like measured it at every 3 months. And we had like a control group, like everyone was offered PrEP, but we had like a control group of people who were offered and did not take it. And then we had a control group of people who were offered and did take it. Everyone had informed consent, like everyone knew what it was, and they just made their individual choices. And then everyone was studied for the year. And we saw that the people who were on PrEP had like legitimate huge reductions, like or like measurable significant reductions in their anxiety directly related to their HIV worry over the course of the year.
Yeah.
And this paper was hell to publish because of like a lot. It was published in Health Psychology, and it was like the concept of trying to talk about a like biomedical intervention having some sort of psychological benefits is really hard for people to kind of wrap their heads around often, because it's not like PrEP is like directly intervening on your brain for anxiety or something like an SSRI. It's like a
Right.
Right.
like a it's like the side of positive sort of tangential effect of like reducing that anxiety. And like right now sex is so much more pleasurable because you're not fucking like, wow, I love raw sex, but now every time I'm having it, I'm low key like anxious and afraid afterwards.
Yeah.
Right.
I
And
ha-
it's
I actually have a pretty specific experience with this because I met some as a backup to back up just for lulz. I met this guy at Meyer. uh he was
Pulling
the
bitches
night
at Meyer.
he was the fucking night stock, like dairy stocking guy at Meyer, and
Hot.
every time I fucking walked in he was like and I was like, okay, I see what's happening here. This is also the otherkin guy.
The weirdo, the real freak.
He
Yeah,
was a freak in the best way. He was a great guy.
I would smash too. Just hearing how nutty he was.
He was fucking very strange but like really good in bed. But anyway, so we sort of it was
As
this,
many of them are.
right. And so he
The
was
weirdest freaks are the best.
yes. So yeah, he was the otherkin and all this other stuff, and I was definitely like and I met him in this weird circumstance, and I definitely was like I was definitely worried about my presentation, so there was all this weird stuff. And so I was like worried he was seeing me as like a guy, and so I had to like so there's all this weird stuff. And he basically, so we went on like it wasn't a date, but it was like we got fucking steak and shake and like talked and kind of like got to know each other. And we like hung out once or twice, and I think we like, God, I'm trying to remember if we kissed or not, but as soon as it became clear that like there was something sexual at all, he stopped me and he set aside a conversation, and he was like, I'm HIV positive, and he like laid it all out. And it was really like it was actually really reassuring because I didn't know this fucking guy. I actually like made like one of like the first time I met him, I got in a car with him, and I think he drove me to fucking Steak and Shake, and like there was some joke about like where the bodies are buried. Like,
Oh my god.
like this dude was weird, and I was definitely like, okay, this dude is weird, but that's kind of hot. But I didn't really know if he was chill and like this was going to be a safe experience. But like that was so reassuring, the way he handled that, because it was extremely responsible. He was he was also like way older than me too. I was like 23 and he was like 32 or something. So that's part of this too. But he like basically was like really clear, like, you know, as soon as it was clear there was something sexual, he like laid it all out. He had been HIV positive for a really long time. He was you know, had been medicated and what's the term, undetectable for a really long time.
Undetectable. Yeah.
And so he laid all this out, and actually that was just at the time that studies were starting to, like, long-term studies were starting to show that you could actually even have unprotected sex at that time, like when you're at that level. And so he like laid this all out and was very clear, like, I get it. And so, and that was hot, and less about hot, but like I didn't know if I could trust this dude in general. And then
Right.
the way he laid that out was like, okay, I get you. I totally understood how responsible he was in the way he laid this out, and how he was good about consent in general. Like that was kind of that first consent
Right.
thing. And so
It's
yeah.
such a green flag when someone is like, let's talk about these things. Let's kind of go through, you know, what's on board, because so many people are uncomfortable, you know, communicating about anything regarding sexual desire or sexual health, or any stigmatized behavior,
Yeah.
you know, so, or status. So,
And then
Yeah, I can't tell you how many times, like, when I'll be like, yeah, like, say to friends or whoever, and just say, yeah, you should ask if you have a new partner, you should just like directly ask what
Yeah.
their last STI testing date was, you know, like when, and like if whatever. And a lot of people would sort of be like, oh, well, then they're gonna say that I don't trust them, da 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 da. And I'm like, well, that is a red flag. That's a red
Yeah.
flag, because why the fuck should you trust them? If anything, they should, like, to me, Maddie, your story, it's like that's showing that that person has respect for your bodily autonomy,
Yeah.
you know, and like your safety, and is like really taking the time to have that discussion with you. And that's hot.
Yep.
yeah,
Yeah.
yeah, yeah. If somebody can be like freaky and weird and then also sweet and considerate and communicative,
Yeah.
it's kind of like,
Right. And it
you know,
was
that's great.
totally like a dom sub relationship. Like he was pretty explicitly like a dom of mine. And so that was like, that allowed, like that, and then other discussions of consent like allowed us to have like probably the biggest power exchange, like sex that I'd ever had. And it was very much like I, you know, was let myself do that because of those conversations. And you know, that shit was hot.
Right.
Yeah,
Yeah.
it's
Yeah.
so much easier to like, and you can take it to a deeper place with power
Right.
dynamic shit in particular, when you
Mhm.
feel like kind of like, you know, nurtured or like protected, or like I can actually trust this person to consider my well-being and
Right.
care about it. And then you can actually, yeah, so you can have way hotter, more intense experiences once that level of intimacy is like, and trust is built. So
Yeah. And then I didn't know about PrEP before that. I learned about PrEP. I was like, yeah, I want to be on this forever, regardless of this guy. And then I had a horrible experience where I thought I was having ketoacidosis and I was going to die
Oh.
because I couldn't move around. Like I literally was at my
What?
job and I was like, I can't walk very well anymore. And then I was at the hospital by my fucking self overnight. And then they were like, no, it's not that, but it probably is just not going to change. So you probably shouldn't take it. So,
wow, I did not know that was a potential side effect of PrEP.
I have
Wow.
no idea what. Have you ever, Devin, have you ever heard of this as a side effect?
I was gonna ask, was it Truvada?
It's been so long. This was like 10 years ago.
Okay, so it had to be Truvada. If it
Okay.
was so long ago, then it had to be. So just, you know, on the, this is relevant to our drug discussion today,
Yeah.
and the way pharmaceutical companies work, Truvada does and possibly can have more toxic side effects. So when you're on it, you normally have to get blood work done, not just your STI testing, because they're checking your like bone density and stuff. It can have effects on your liver, all these, and it's not, and like, they're rare. Let me be clear, they're pretty rare. But Descovy is the next generation, and they figured out so Descovy has way fewer side effects than Truvada. They're both PrEP. These are both PrEP.
Right.
But Gilead, who makes these drugs, knew that PrEP's patent was going to lapse in 10 years. So rather than let Descovy come out, they kept it until the Truvada went generic, and then they released Descovy so that they could still be making their profit. So yeah, so Descovy is like this, right? It's the safer med. Um, and like for example, I had a friend who had a kidney removed, and so he was like contraindicated from ever being on Truvada, but he could have been on Descovy if it was out at the time. And
Jesus
so,
fucking Christ.
So then when you
yeah,
think about there are people who seroconverted because they couldn't be on Truvada during that period of time,
correct.
but they could have been on Descovy. That's so,
Oh my
oh my
God.
And
God.
what's super fun is Descovy, they never tested on people with vaginas and uteruses. They only tested it. So it's not approved for anyone who basically, like, you can't take it if, like, I mean, you can, but there's no, like, essentially the way the medicine works is it builds up differently in the rectum than it does in a vagina. And so so for example, like if you're taking PrEP specifically to have anal sex in a safer way, it only takes like I think like a week or two before the medication is built up enough to provide that like really high, like 98% protection. But in the vagina, it can take up to a month. And so they never studied this in Descovy, though. They never studied the medication for people who have vaginas. And so this is like a huge inequity too. Like I definitely, this is some of the work I do right now. There's a issue with like trans men who were automatically shifted from Truvada to Descovy because, all the healthcare people, they were all told by Gilead to do that so that they could continue making profit. And a lot of people who, in theory, Descovy should work as well as Truvada, but it's just never been fucking tested to know that. And so
Right.
people, yeah, yeah,
Jesus.
Wow. And this is exactly why, like moving away from the current model for accessing pharmaceuticals that we have in the US, and because the US is kind of like the central point where a lot of medical research happens establishing these drugs, it affects the whole world. Like the model that we have, and it also connects back to conversations about intellectual property, right? And like
Right.
holding
right.
patents to drugs. But if we had like we just need to break up. We need to break up these corporations, and we need to stop treating medication like it's intellectual property,
It's
Yeah,
nuts.
and giving moving towards a more informed consent model of drugs, in my opinion, where it's not your doctor who's been influenced by a lobbyist who tells you all of a sudden that you need to switch to a different med because of financial concerns. It's just like, yeah, it's just abhorrent. So,
yeah,
Yeah.
yeah, no, for sure. And, something that I've thought about a lot as I've been doing this work for so long, especially in the realm of HIV, is, for the first time since it was essentially discovered, there were more heterosexual people who were diagnosed with HIV in the UK than there were gay men.
Yep.
And a
mm,
huge reason for that is, to be clear, you should be putting the correct amount of resources to the subgroups that are being disproportionately affected by things. That's not necessarily wrong, but the problem is pretty much exclusively these resources have been directed to gay and bi men, which simultaneously stigmatizes queer sex among these folks, right? Because the implication is like this is the only group who is going to get sick from this, and then simultaneously actually does end up hurting
mm-hmm.
heterosexual people.
Yep.
Heterosexual people have some of like they're honestly kind of the people who have the most unprotected sex and honestly have some of the worst education in terms of this stuff because they haven't been directly targeted for this in the same way like queer men specifically have been or queer communities. And so I'm not trying to say heterosexual people are like specifically oppressed in this realm, but you see the ways that these things actually had these unintended consequences.
Yeah.
Right. Yeah, because I know I've seen you talk about, and correct me if I have it wrong, that in New York, Black women are the growingest population in terms of HIV, right? And I've certainly heard that elderly straight people, especially like having sex in nursing homes, that's also a big population where, you know,
Yep.
they've been overlooked. They're not seen as sexual beings. They're not taken seriously, and so like conversations about PrEP and getting tested just don't even reach them.
Yeah.
Yes, they for a long time these sexual health surveys that I now work on with the Department of Health, they cut the because of like sort of the CDC's interest in this data and stuff, they cut off the eligibility criteria at 40. And this, like when I ran it this year, we intentionally did not have that criteria. You could take it for as old as you were. And that was actually a direct result of like what you're talking about, like community members saying like this is really fucked up that you guys are only studying this in 40-year-olds because people over 40 are definitely having sex,
Yeah.
and
Yeah.
this is a huge issue. You know?
Yeah, 40, like people over 40, fuck, like what the fuck?
Yeah.
God.
Yes, and I do think because we do only talk about HIV and related to like gay and bi men, like you said, like black women are 22 times more likely to get HIV in New York City than white women. It's like a dramatic difference and inequity. But these same women will say that their risk of getting HIV is really low because they've literally never been taught about their risk or like any
Right.
of this stuff, because it's pretty much like when you hear about HIV, it really tends to be kind of couched as like this is a gay man's disease, which it's not.
I just
But
want to
yeah,
shout out Bat Bite 56 for gifting 1 month tier 1 sub to Bouncy Castle
Oh,
Parker.
thank you, Bat Bite. And
hey,
good follow as well.
Yeah.
Yeah. I saw it's Farrar mentioned in the chat that PrEP rollout is getting paused in the UK, which I don't know if you know anything about that. That's news to me. That's wild, but I
Yeah.
assume it's their just because they make so many cuts and restrictions to their healthcare service in general lately. So
Yeah.
right. I haven't heard about that, and I wouldn't. I should know more. I did not actually know that they were doing that there. I do know that in Texas and some other they're actually trying to like make PrEP unavailable because they think it's permitting promiscuity.
Yeah.
oh my
So we're
god.
definitely having some of that shit happen here too, in ways. But and yeah,
Normal
injectable
country.
PrEP exists now too. I
Wow,
know.
that's wild. I didn't even know that.
Yeah.
So
Yeah.
uh so just to unless we have, not that we need to change the subject, but we did promise drugs.
Talk
Yes.
more about the drugs people want to hear. We've been talking a lot about PrEP. Let's talk about the other
Yes.
drugs.
So
And
first of all,
we'll circle back. We'll
yeah,
circle
oh
back
yeah,
to it
Yeah.
because I think because harm reduction is kind of the unifying theme here and all of
right.
those things.
Yes.
But
Yeah.
yes. Oh, do you have smooge, Maddie?
Yeah,
First of
so
all,
that was what I was gonna crack this. This is smooge, and you might be like, oh, is that strawberry banana? No, it's strawberry daiquiri hiding.
hard smoothie.
So
This
this is,
shit is.
yeah,
It's.
Oh, it's a
I think it's nasty.
smoothie.
It's an
yeah,
alcoholic smoothie.
basically. Okay,
Not to yuck your yum, but that does sound gross.
no, it's so good. Okay, so I get it. So basically, it's actually they just call it a hard smoothie now. This is produced. So this is by Holmes Brewery in the Ann Arbor area, which is where I live. And it's so fucking good. I think you can get it nationally at Whole Foods now, is what I've heard. Um, but it's, yeah, they used to call it like a smoothie seltzer or something like that because it's got a little bit of bubbles. Um, and it is so good. It is so fucking thick and like, it is.
Finally, thick alcohol.
Oh, literally, I'm like, oh.
said one person ever. Well, you and your
It's so
spouse.
good. Trust me. If you tried it, like,
Can you crack it on mic? Can you
Oh.
give us a close? Oh,
Mm,
grip
it's
it and
very
rip
good.
it. Yeah.
grip it and rip it,
Before
baby.
before we move on, I do want to highlight one question we got in the chat because I know it's relevant to stuff that you know about Devon. Gwenny Thing asked, "How do you ask for all the STD testing? I always feel like they're holding back and making assumptions." And I know your own work, Devon, has targeted this because a lot of times women are not even like asked about their HIV risk or if they have anal sex, because that's
Nope.
considered like, tainting their virtuous womanhood to imagine they want to take it up the ass ever. So I don't know if you wanted to
Right.
kind of speak to that as a problem.
Yeah,
Eric, it's not
I'm
hard.
assuming.
Sorry, go on. My drink is not hard.
What do you mean? It's not hard.
Oh,
It's
Eric just said
alcoholic.
Like, is it
hard
like
sludge.
chunky?
No, Eric just said hard sludge, and I'm like, it's not hard.
Oh, ew. Yes. Gross. But okay, I'm assuming when your question is specifically talking about with a healthcare provider and not your partners. I think that's like my interpretation of it. And yeah, like Devin said, that's something I was running a in-person intervention in New York City, like in my postdoc work, and I had to really fight with the head of STI clinics to ask cis women about to give them 3-site STI testing, which if you don't know what I'm talking about, that's you can get STIs in your throat, in your rectum, and in your genitals. And so at the time, the protocol for the New York City sexual health clinics was only to screen this stuff for anyone who was a man who had sex with men or a trans woman. That was the only people
Right.
which is obviously extremely fucking stigmatizing, right? To
Right.
only single those people out because those folks would go to these places and be like, I'm like, what the fuck,
Yeah.
So, or like, great, this is a necessary service, but like, why are you only asking me? So yeah, I had to really fight with them to actually start how to like find all this data on like the amount of cis women having anal sex in New York City and basically shout at this epidemiologist. I'm not an epidemiologist. I was like, look at all these women getting fucking rawed in the ass.
Just it's like that. It's like walking up on the street. Hi. Have you gotten rod lately? Just like the fucking man on the street interviews is what it was.
Yeah, Billy Eichner. I think we could send Billy Eichner to ask women that. I think he's
Yes.
not
For $1, would you
Yeah, it's just
would you
like-
let me fuck you in the ass right now?
I do know someone who's fucked Billy Eichner. I do know someone.
Oh,
Ooh.
you gotta say,
Yeah,
okay, you
yeah.
can't. You gotta take a
Okay,
tangent.
well, Jen, who's in the chat, my friend Jen Bowser, she knows who the person is, but
Oh.
somebody who's
Was it good?
She probably already knows who it is, but it's somebody who went to Northwestern for acting and is open about having fucked Billy Eichner, and also the Penguin from Gotham, that little homo. So
Cute.
Wait,
yeah,
what?
anyway,
Oh, from the show
Yeah, the
Gotham. I
actor.
thought you just meant like,
Yeah.
you know, the penguin who lives in Gotham and has minions.
No, the penguin actor who has like the really like pasted down black hair, side part, whatever. But anyway.
Yeah, he's cute. I think he's hot.
Yeah,
Anyway,
no, he's adorable.
but yeah, I would. So the thing that sucks is like I can tell you like, yeah, you can go to your provider and ask them to test you if you have had oral sex and you want to get a throat swab. If you've had anal sex, you want to get a rectal swab. Like you can ask for those things. But I have also had friends who are cis women who've asked for those things and have had their providers be like, what the fuck are you talking about?
Jesus
Or like they
Christ.
don't know how to do the swab, and so they've had to go elsewhere to do it. So yeah, I can certainly ask for that. And then if you want to make sure you're getting tested for everything, you ask for a full panel. And I say this because I think a lot of folks don't know that a couple of things. One, when you do the pee test, if you're just peeing in a cup, that's only testing for gonorrhea and chlamydia. And it's only testing for the presence of gonorrhea and chlamydia in your genitals. That does not pick up an oral or rectal STI. You have to get a swab. And then the other thing is that, yeah, syphilis and HIV are only detected by a blood test. Well, not only, there's a rapid oral for HIV, but in general, if you're going to a clinical setting to get tested, Sometimes they'll let you opt out of the blood because if you're like me, you're a fucking bitch ass when it comes to getting your blood taken. I hate it, but
Yeah.
like, I know Devin and I also share this quality.
Yeah. Well, that's a whole fight that I'm having right now, and that's a whole other tangent. Maybe we'll get into it. But yeah, the blood test.
Yeah, it's a whole thing, but yeah, so I hope that answers your question, Wim. But yeah, you can be really intentional. If you are getting both a urine and a blood sample, you're most likely getting tested for all STIs. Like just know that, like if those are the samples being collected. And then also if you want to get an oral or rectal swab, you normally do have to ask for it. And I don't know where you are in the country, but depending on where you are, more and more healthcare providers are starting to be more open to that. But
Would you say
yeah.
that how important would you say doing those two things are for like getting a full, like, I don't think I've ever had an oral or an anal swab for STI tests. Would you like, what would your recommendation for like those specific things, like would you be like, if you suspect that you have something you would need to get tested that way for, or would you be like that should be part of your like regular STI checks, is doing those
No,
things?
this is a super good question. I'm glad you asked. It should be a regular part of it because oftentimes oral and anal STIs are way more likely to be asymptomatic. And the reason for that is like there's just less sort of like in the way that, so for example, like vaginas are far more likely to be symptomatic from an STI than a penis just because the infection happens internally and there's a lot more sort of like tissues that can like ooze or like some things can give you the indication something's wrong, whereas a lot of times gonorrhea or chlamydia, for example, can live on the skin of the penis, and so if it doesn't actually get into the internal tissues, it's not going to be symptomatic at all. And so in the same way with rectal STIs, sometimes people will get symptoms and sort of be like, oh, my ass itches and stuff, or there's something uncomfortable, but oftentimes they're asymptomatic. So yeah, if you're regularly having anal and oral sex without condoms, like I would definitely recommend kind of like working that into your regular STI screening in general. If it's available, hopefully it is.
Yeah.
Good to know. Yeah, because I've only ever gotten those when I already had symptoms and was like, I need to figure out what's going on. But
Yes. Yeah.
kind of reminds me of the conversations about like HPV and like how the initial rollout for the HPV vaccine was only, for women for the most part,
Yeah.
because of the cervical cancer risk. Even though anybody who is like doing or providing oral on someone could get throat HPV in their throat and then have no
Absolutely.
symptoms and then have throat cancer down the
Right.
line. So,
Right.
oh, I see you've added the penguin
Yeah.
man to
The penguin's been
screen.
hanging out for this whole
Yeah.
Just
conversation.
a
If you would
visual.
If you would smash, please put a penguin in the chat. A penguin emoji.
I would top this dude. I would
smash.
I want to fucking
I'll help you top.
he looks so
hold him down.
pathetic.
Yeah, that's a poor little meow meow. That's
He's
my
such a poor
specialty.
little meow meow. Look at that. Look at
Where are
that.
y'all finding penguins?
Oh, do
These
you
are
see?
the most interesting reactions. Did you guys create these reactions?
No.
Oh no, the emojis? No, they're just
Yeah.
they're just what Twitch has, but we're gonna make some
Oh,
soon.
Yeah, we will.
hell yeah.
We'll definitely update that. Talk about that before we get off, because that's exciting developments. Emojis are coming.
Yes. Big
And
things coming.
to Sweater Alliance to ask if it's been years, if you've been sexually active in those years, then yeah, I would definitely get tested. Even if you're in a monogamous relationship, that's the other thing I say all the time. Like if you're in a monogamous relationship, it is not saying you do not trust your partner to get tested. It means that you care about your own sexual health and your body and like hopefully that's not what's happening, but I cannot tell you how many people have gotten STIs, specifically HIV, because they are like, I'm safe, I'm in a monogamous relationship, then don't get tested for a long time. And next thing you know, you get diagnosed with AIDS at the same time as HIV because you're like, you think there's no way you would have it, right? So yeah,
Right.
I think the kind of rule of thumb is like if you're having like condomless sex with multiple partners to get tested every 3 months. And if you're having sex with a known one partner, that you're both like supposed to be monogamous, it's like 1 year is kind of a good rule there. So
Mhm.
hopefully that's helpful.
Yeah.
Yeah.
I also
And
do I also do between partners as much as I can, is kind of because I'm poly,
Yeah.
so I try to like, and I'm not somebody like that's a lot more difficult if it's depending on how regular you're hooking up, but yeah, that's also a
right.
good thing if you
Yeah.
can.
Yeah. And
Oh,
just oh, sorry. I just wanted to
oh, I was
touch
just
on
gonna,
Jen's question about HPV. That might be what you're also.
that's what I was gonna say.
Okay,
You
go
can
for it.
say
No, you
it.
go.
Oh, yeah, no, it is definitely like, it's not that it doesn't work. It's definitely because insurance has decided that after the age of 40 that it's not as high of a risk. So they, yeah, that's my
Yeah.
understanding at least.
Well, my understanding as well with because I was in a clinical trial for Gardasil back in the day, and the age cutoff for
Mm,
Gardasil was also because HPV. There's so many strains of it. It's so widely
right.
spread in the population, just like herpes. Like that, the part of the idea was that up to after a certain age, the odds are really high that you already have it. And so then they're
Yeah.
just like, well, fuck you. A vaccine's not going to do anything for you. So then you're not going to get the vaccine. And so that's why originally, I think the recommendation for Gardasil was like 25. Like, don't get it after 25 because it won't matter. And now they say
Wow.
40. But I would still, I don't know. I would still push for it, right?
It
Like, because
definitely, it
it's so
does
fun.
matter because yes, there's a shit ton of different HPV strains, but the vaccine is specifically designed to protect against like 3 or 4 of the ones that are most likely to be cancer, like turn into cancer. So like yeah, for the most part, on most of those strains, like a lot of people have HPV. Like I have it right now. It's okay.
Right.
Right. Yeah.
But like it's like your body normally will naturally fight that infection off. Like for the most part, most people's bodies just fight it off, and you would never even know you have HPV unless like someone decided to do the test. Like when I went to my last pap smear, they actually like were not going to do a pap smear, and therefore they weren't going to test for it, and I advocated for it, and then I found out I had it, and so now I officially got approved to get a pap smear annually by my insurance because I had that test. So like that's part of the protocol, whatever. But um, yeah, I mean, if you're sexually active with multiple partners after the age of 40, like you still could, in theory, get the version of HPV that is more likely to cause cancer.
Yeah.
Um,
So push for the vaccine if you can. Yeah. If you feel like,
yeah.
yeah. Yeah. It's a good question. And yeah, yeah, Gwenny thing. I think it used to be 26 for some of the reasons we just described, and it's kind of ever changing. And it was expanded to men after a certain point, and so on and so forth. But
Hmm.
um,
So
yeah, do we want to transition to talking drugs?
Yeah.
so yeah, I'm having a bev, and that was intentional.
Yes,
Do you have your vape?
I got the Delta 8. Maddie looked this up, and it is legal to consume substances on stream if it's legal in your area. And if you don't pass out off of edibles, because somebody did get banned for falling asleep on stream after taking an edible.
Yeah, and we can thank Snoop Dogg for that apparently. So,
Yes.
but
Incredible.
don't don't report us. Don't be a narc
Don't
because
report us. Don't be a
I don't
cop.
know what would happen if he did.
Yes.
So just don't.
Yes.
Um
So I'm gonna take a hit as well, even though I've never been altered on stream. So hopefully, but there's y'all can carry the conversation if
yeah,
I get
if you
incoherent.
start zoning out, we'll just you know. um
Well, we just tends to make me extremely verbose, as Devin knows too well, from my 50 voice messages that he will receive when I am in super stoned.
We'd love to see it.
so yeah, that
And
was
Yes.
yes, what's everybody's favorite drug? It's Farrar, exactly. Yeah.
Yeah. What's
ooh.
everyone's favorite drug?
So let's while those responses are coming in, let's one of the things is that we were talking about how the three of us have very different like experiences with drugs and like the amount of drugs we like will take now or have taken in the past. So I was thinking that that could be a good way to kind of start off kind of how.
Yeah.
So
Yeah. Who wants to go first?
you go first. You go first. Your name's
So
on the page, so you have to.
Oh, Lord. Okay, so so have never been a heavy substance user because I have that autism thing where I'm very, very sensitive to most substances. And tea has changed that a little bit. I can drink a lot more now because I have more muscle tone. Like that's, as I understand it physiologically, why men stereotypically can drink more. Um, but I used to be for years like I could have two drinks and then my body would just like not let me drink any more than that. It was like this is awful to me,
Mm-hmm.
to the point where I went to Ohio State beer pong central and I would have to just like hide my cups because I also sucked at beer pong, so I would have to drink all these cups and I'd just be like hiding them in the basement, because I couldn't drink them. um, and then yeah, same thing with weed. I had like avoided using weed too much. Like I mean, all of my friends, smoked weed, and like I would sometimes partake, but I was not big into it. And then I discovered my baby Delta 8 synthetic weed, which is a little bit milder. Real stoners are like, that's baby shit. What are you doing taking that? But it gets me fucked up, and it definitely helps with sensory issues. I find in a big way, and is just kind of a pleasant
Mm-hmm.
way to kind of unwind a little bit. Though also I'll still be in the what's that Tumblr post where it's like when you're high and you're rotating a 3D spider in your mind and thinking, I think my friends are mad at me.
Yeah.
What is Delta 8? Because I guess I didn't realize that it was like I'd heard of it and I've heard you mention it, but I don't actually know what it is.
Yeah, so I can't explain chemically how it happens, but basically they take the CBD hemp plant, which is a legal, varietal of the weed of the marijuana plant, because it isn't psychoactive, and then somehow they make it psychoactive using chemistry, and so maybe my jaw will fall off my face in 10 years. Like
We
we
don't
don't
know
really
yet.
know. We don't know. And there's many different synthetic strains of weed at this point. Delta 9 is traditional THC, like what we normally think of as marijuana. Delta 8 is its most common little like baby sister, if you will. It does get you high, but it's a little bit less intense. You have to take more to get more of an effect. Um, and then there's Delta 10, there's HHC, there's all these other synthetic weed strains that the company that I buy from is always sending me emails about. We've just discovered a new synthetic weed strain and here's what it does. But they're all synthetic, and that's why they're legal almost everywhere, and why you can buy them from a variety of different brands of questionable trustworthiness in gas stations compared to dispensaries. Like synthetic weed you can
Right.
buy almost anywhere, whereas like real weed you have to buy at a dispensary here in
Oh, so
Illinois.
it's like what was that fucking horrible shit that they used to sell in gas stations?
Oh,
I was just gonna say it's not that.
Yeah.
yes, it's
Just
not
it's
not kratom. What's
Yeah,
it called?
no, that's what I was
Clark or
thinking of.
something.
Kratom is what I
What
was
the
Yeah,
fuck
thinking
was that?
of.
which somebody told me kratom to them tastes like dog's ashes.
I haven't
Oh,
I
spice. It's called spice. That would fuck you up though. Delta 8 is not like spice was like I don't even know the difference either, but I just know that
Yeah,
spice was like really bad and Delta 8's like actually like
I think
really fine.
yeah,
Spice and Kratom
salvia.
were like unrelated to weed actually. Like there was similarities in how it felt and how it
Hmm.
worked, but I don't think it was like actually had anything to do chemically with weed, I think. But I could be wrong on
Yeah,
that.
Hmm.
yeah, and Bouncy Castle Conqueror salvia is what I knew it by. Yeah, fuck that shit. That shit just like gives you a headache and feels like
Oh,
something's
salvia.
not right here.
Oh,
Yeah.
I see. Okay, I was talking about kratom. I thought I have not heard salvia talked about as spice. Salvia is fucking crazy. I did salvia once and it was very fun, but very fucking weird. I've done. We'll get to it, but I've done a decent amount of drugs, and that was the most intense, probably one of the most intense I've done, just only for 30 seconds or something. That shit is fucking weird.
Wow. So it only lasted for 30
Oh
seconds?
yeah, that
Wow.
shit, and it's like I didn't do a lot, but like that's the thing with salvias. It's like super short and but like really weirdly intense. Um
Wow. Bouncy Castle says, on Salvia, I lost all spatial awareness and couldn't walk.
Yep. Yep.
Yeah, it's really bad. That is not a fun drug.
That shit is
No.
fucking wild.
Yeah.
But anyway,
No.
was there more backstory that you had?
That's about it. That's pretty much my relationship to drugs. Like that for most of my life I haven't been able to use them that much,
Mm,
which has kind of protected me from a lot of more like just like addictive behaviors that I've seen in friends who have similar, deal with similar things as I do. So in some ways it's been kind of protective, but it's kind of nice now to be able to get fucked up and to like it. Like I'm finally at a point, where I am physically capable of handling it without throwing up or feeling bad. And I
yeah.
found like a substance that's like mild enough where I can actually kind of decide, okay, I want to get fucked up on this today. So like, when I was at Furfest this year, I was blasted high on Delta 8 lean, which is like a liquid that you pour into I think I put it in seltzer or something. And, so instead
Mm,
of an edible, you just drink it. And I was completely
I gotta
fucked
try
up
that.
just floating around the convention center. Um, and it actually felt manageable to me. So that's me.
So, so other Devon.
yes.
What is your experience with drugs like historically and currently and all that?
So I grew up in Florida, and so I was like in the DARE program,
Oh my
and I
god.
don't know if anyone like remembers that or was in that too, but I had that like when I was like in fifth grade, and they had like cops come in, and they were like, essentially like, here's all these drugs from like THC, weed to like heroin basically, and they pretty much were like, if you do any of this, you're gonna die. That was like the
God.
message. Or if not die, you're gonna become like, you're gonna basically be like homeless on the street and like have no life. Pretty like that was
Mhm.
like pretty much the messages that I was taught about drugs. And so that had an extremely effective, I know like DARE is not effective. Like there's been so many studies showing that it's not effective at all, but it definitely had an effect on me for like a while. Like I remember when my friends started smoking hookah for the first time in high school. I was like horrified. I was like, that causes cancer. Um,
Oh my god.
but yeah, dude, I was like really like not cool with the any drugs. But then I
Were you okay?
started
So you were like just be like you were like straight edge. Like if your friends did something, you were like, that's bad. How could you? Like that level of like.
absolutely.
Okay.
Yeah, like when we tell you I've come from one spectrum to the other, it's not even it's not an understatement. Yeah, no, I was actively like I remember the first time when my friends told me she smoked weed, I was so like scared for her,
Yeah.
like and because I was never like I don't think there was ever a point where I was like trying to shame my friends for doing it, but I was legitimately afraid for them. Like I was
Right.
like afraid that it was gonna have all these like really bad effects at the time. And so, but then I started knowing more people who were smoking
Mhm.
weed. Like I went to undergrad. I became friends with two. This is like the most like classic intro to weed. I became friends with two philosophy majors who
Mm,
were just like
the biggest weed smokers,
Yeah.
yes.
the
That and
biggest
art
weed
students. Yeah.
smokers. Yes, so I started like smoking weed with them. They're the ones who got me to sort of do it. And I would just casually do it like when I was at their places, like very social. I never had my own stash. I lived with a roommate my last year of undergrad, and I remember like really struggling to write. When you apply to PhD programs, you need to write like a cover letter that you can't just like regurgitate the same cover letter. You have to like make it hyper specific to each faculty member at the institution and like
God.
give like
Yeah.
so and I applied
Mhm.
to like 14 of these things, so my brain was like dead, man. Like I was like fucked up trying to like pump out content basically for these applications, and my roommate smoked weed. I was like, dude, I've heard maybe this helps with writing sometimes, and I'm really anxious and like my brain can't work anymore, so can I like hit your bowl? And then I did, and all of a sudden it was like all this anxiety of writing and all this like,
Yeah.
like fog, it like lifted and I was able to write it. So then I went to grad school in Connecticut, and that was when Boston had recently made it wasn't recreational, but like it was pretty easy to get a medical card and go to like a dispensary in Boston at the time. And so I had a friend up there who I just started buying weed from her. Actually, the first time I got weed was my roommate's boyfriend grew stuff, and he like flew in from Oregon and like gave me a bag of weed that she didn't want.
Wow,
Wait, he brought the
that's
weed with him
nice.
from Oregon on a flight?
He was like ridiculously sketchy about
Oh my
his
god.
like practices with traveling with weed.
Jesus.
It was like really like he literally had a bag of it. It wasn't even like I think he necessarily was clearly hid it some way, but like yeah, it was
Yeah.
like that. And
Wow.
so grad school was like really hard, both like brain wise, but also like I had just been removed from all my community I've been in my whole life. Like it was really rough. And so weed started being like the thing I could at the end of the day, instead of drinking, like I drank, in undergrad. Like I definitely did alcohol in high school and shit like that too. That was the drug I would do. But grad school, I needed something I could actually function on. And it wasn't just functional. I found that it was actually helping me cope with like these horrible circumstances I was in.
Yeah.
And like Devin said too, I have I have like made jokes before that THD helps me like turn on my personality because when I'm just completely sober and like talking, like I tend to like not show many emotions on my face. I tend to be a little bit more monotone. Like I tend to just sort of like I have to fake this like outgoing personality oftentimes, like especially in professional settings or whatever, is to make sure people don't think whatever. We all know about these
Mhm.
things.
Yeah, yeah,
Yeah.
And then
yeah.
I would
Masking shit. Yeah.
smoke.
Right.
Yeah, masking shit.
Right.
But then I would smoke and I was like, personality. Like,
Right.
I just about like was way easier to socialize all of a sudden. It was way easier to not be anxious in social settings. I didn't give a fuck as much if I said something that was like wild or like inappropriate because it just didn't like it was like whatever, it didn't matter as much anymore. It was like a social lubricant for me for a while. But I've also since then got really into psychedelics. Like really love acid. And mushrooms are fun too, but acid has become one of my favorites. And I have a friend who's studying to be a psychoanalyst who's like, she's like, which I think is fucking, it's like, wow, I have the craziest conversations with her, but she thinks acid is like one of the, she's convinced Freud was on acid because there's no way you come up with the id, ego, and super ego if you did not understand like what it feels like to basically have all three come down together, which is what acid kind of does.
Yeah.
It stops your it basically makes your unconscious mind come to the forefront. So any feelings you've been suppressing, any like emotions you haven't processed, you do acid and it's like, hey.
Right.
um, so the psychoanalyst friend is like, she's like, I think acid can help people process trauma more than like a year of therapy sometimes. If you're in a good circumstances and you're in the right setting, like, and I feel that way because I stopped taking my SSRI for anxiety. And I had tried multiple times to stop taking it. And it wasn't until I started doing acid. And I really think like, and doing some deeper trauma processing with therapy too. But it was kind of this combination of that. And I don't know, this is also, I guess, like a neurodivergent thing too, of like not being able to necessarily always be aware of your emotions when you're experiencing them. Like you're too hyper analytical to realize that you are feeling feelings. And that for me has been a huge release with psychedelics. And I guess weed to some extent, but I definitely notice it more with psychedelics. I feel like I can connect to my feelings way better or like kind of like understand what I'm feeling and why a little bit better. Um, but I hate Molly and I don't get along. I do not like Molly.
The come down on
Uh,
Molly sounds like it's awful from what I've heard.
Fucking, it's really awful. Acid the next day, I'll feel like the most chipper bird in the world. Like I feel like I have no, if anything, I love how I feel after it. I feel super clear. I feel super like, but MDMA, well, I guess it's Molly and MDMA. I guess in theory are the same things, but a lot of drugs just aren't as pure as they used to be in general. So I don't know if that's part of it, but it was really good Molly, but god damn, I like couldn't wake up for 4 days straight. It was horrible.
Yeah,
Oh
My brain
yeah.
does not do well with it. Yeah.
my experience with the lingo was that at the when I was doing it at the time, I people would say that ecstasy was like not was like usually cut with something, but Molly was the what people called it when it was
Yeah.
like more pure
Yeah.
MDMA, but I don't, who knows. I wasn't
Oh.
I wasn't like test stripping my shit, so who fucking knows.
Yeah. That's what it's supposed to be. Ecstasy, right, is supposed to be like kind of cut with shit where the MDMA or Molly is supposed to be super pure. But even pure, like what does that mean in our current
Right,
drug supply, right? Like
right.
it's really hard to find anything that like I know someone who's like grown up in New York City and like he basically was like and who was in like the party scene and he said he could tell like a distinct difference between the quality of drugs like even just like 7 years ago compared to now, like whether it be Coke or Molly or anything else, like even when you think you're getting the pure like really pure shit, it's just not the same quality as it was like a decade ago, which is pretty wild.
Yeah.
Wow. I mean, I knew like that jump had happened, but like my comparison point was always like the 90s compared to now, or like the fucking 70s compared to now. Like that's wild. That like, is it
Yeah.
just like why is this happening? Like why is everything seemingly from like cocaine to like Molly just like less pure now? Is there just like less of a supply of like the pure forms of those things, or is there just a more strong like legal crackdown and so people pad it out with other shit like fentanyl, or like what? Does anybody know?
I I think it really is just like more people were willing to take drugs, so there is more of a demand, and also like you said, I don't know. I think it was kind of a combination of like um, drug war shit, but like we said, this is like kind of it's not fully post drug war, but this is 10 years ago. This is not peak drug war, you know.
Mhm.
Right.
So I honestly I don't know. Like I'm not super sure why that's a thing now other than maybe there's just like more of a demand and
That would
so
make
the
sense to me.
supplies yeah like more people are openly taking drugs now I think
That's yeah. I mean, just
Yeah.
or
from
using
the,
them.
I don't know, I don't know the statistics, but just from the discourse around things, like definitely, definitely, it feels much more uh, acceptable than it was. And I know even some of the legal stuff has changed in a lot of places. In Arbor, which is the big city in the area that I'm in, they've decriminalized psychoactive mushrooms even, and
Yeah,
and that's a thing that's happening a lot more, like that. And there's definitely a lot. a, I would have to imagine there's more demand just from the acceptance of it.
I think so, but kind of to Devin's point about like all drugs should really just be legal and like
Yep.
you should be able to just like use it with informed consent.
Right.
I think it would be awesome if Molly and cocaine was actually somewhere that was like, there was an actual standard for the quality of the substance and it needed to live up to that standard. And I know we talked about this briefly like in our chat before this, but um that is what happened with alcohol. A lot more
Right.
people were dying of alcohol disorders or like use during prohibition because the liquor people were drinking was just so extreme and high in alcohol content that it was like causing cirrhosis of the liver so much quicker, and that's why we have
Mhm.
regulations on alcohol content
and
now.
and not to mention that the
Yeah.
government would actually literally poison supplies at times to
Right.
actively kill people, which it's the same kind of
Mhm.
shit that still happens. um
Right. Yeah.
I that kind of brings me to my experience with drugs, which is uh I'm very much opposite of both of y'all's, it sounds like. So I grew up as a stoner. Like that was my whole shit. I think I first smoked weed when I was about 14, I want to say. Uh yeah, my brother, I have an older brother, and he was like, he smoked weed, and so I smoked, like, that was the first experience. And then it was funny because I didn't really smoke, like, I smoked once, but I always had long hair, which probably looking back had way more to do with like gender identity than like being a stoner. But I had long hair, and I wore like fucking stoner shit, so everybody assumed I was more of a stoner than I was. But I started smoking weed regularly in middle school, and then basically throughout all of high school, I was smoking, like, I smoked all the time. I also tried a lot of other shit during that time. You know, I was a stoner with stoner friends, and so we try. I tried. I tried. I did acid a couple times. I did shrooms a little bit more than acid. Um, I really liked ketamine, actually, which I don't know how safe that, like, I don't know a ton about it. I never K-holed, I don't think, and I know that that gets weird. Um, and also Molly. Molly is very much my friend. I think it's Farrar said earlier. I'll have to ask the chat again when I'm done what everybody's favorite drugs is, because I was not able to pay attention at all. But I did see it's Farrar said. What did you say? Something like I love uh Molly because I'm a god priestess or something. But uh yeah, I had some really good experiences with Molly. In particular, the entire reason I realized that I'm trans is from Molly. I had I it was just me and my best friend at the time. And this was like fucking that whole like, you know, I could tell a long story about just me and my this friend's relationship. It was very much like straight dude friends, but like, you know, also we like fooled around, and it
But
was
I know
this,
what you are.
yeah,
You have the button.
yeah. um like we fooled around, and it's a whole thing. But like,
The cat.
yeah,
The cat is alarmed. The
yeah.
cat said, "There's a homophobic dog here, mother."
Mother. um so I was with him, and I think the thing that actually kind of like first made me start thinking about it that day was like, he complimented me. I had a huge crush on him, and that was the whole thing, and he was straight and blah blah blah. He complimented me in a way that felt like a guy would compliment a woman, and I like don't remember what it was, but it just like made me feel that way, and it felt like really good. And so he actually like left, and so I spent a lot of this like roll, what is, I don't know how to it, what, like a lot of the time I was rolling, like that trip was by myself. Um and so I was sitting alone in my room and like kind of feeling that energy, and I was just like, I literally asked myself, am I trans? For the first, probably one of the first times in my life that I had actively asked myself that question. Um, I, uh, I literally remember one other time in my entire life that I was like and this was like a couple years before, when I was like 17 or something. When I was sitting in bed and I was like, you have to figure this out if you are like trans or something. And I basically came to the decision that like I didn't know. But it's like, it's weird because like I have no memory of even thinking about that stuff, except this one memory before that of where I was like, you clearly been thinking about this enough, you need to make a decision on it. So it was so, my point is that like it was so repressed that I was not aware of it at all. But when I was rolling, like Molly just physically prevents you from being upset. Like
Mm,
you're only getting the happy chemicals. You're like, it's just pure happy
yes.
chemicals. And so I was like, I just happened to be like, are you trans? And I was not like my brain was incapable of being afraid of that question, or being afraid of the like where that question, if I said yes, where that led. And so I was just like completely like, it wasn't a thing that I thought like that in night in particular. It wasn't even a thing that I like thought a lot about, like had to like deliberate on. It was like, yes, I am a woman, I am trans, and all I was capable of feeling was like fucking so excited to have figured that out and be sure of that. And then of course after that it took me like 2 or 3 years of like literally constantly like, am I trans? Like that was the only fucking thing in my brain for about like 2 years. This was to set the stage. This was when I was 18, 19 in like 2011, 2012. So very different era.
Yes.
But yeah, so this is, so I have a lot of good, I've had a lot of good experience, really good positive experiences from drugs. My mom even does. My mom is like an old hippie from the 70s. She when I started smoking weed regularly with my brother, my older brother, and when I was like literally when I was like 15, like what sorry, I don't want to go on too many tangents, but there's this great one of the first, an early time that I smoked. It was with me, my brother, and one of his friends, and we were high as fuck, and we were in the basement, and my mom comes down. Like we hear my mom walking down the stairs, and we're all like, "Oh fuck, we're way too high to hide this." And this is when I'm like fucking, 15 or something, 14 or 15 or something. And so I knew I couldn't not act high. So my reaction was like, and we're all, of course, we're all standing weirdly in the middle of this fucking room, right? Like, like we're not sitting around doing something. Yeah, we're all like fucking the three of us are like huddled in the middle of the room, like standing talking. And so I was like, fuck, what do I do? And so it's like, I just turned around. So she came down. And she came down and she was like, why is Maddie? And so we're like, the three of us are lined up facing her, except me, who's facing the other way, fucking cracking up. And my friend, and
Super
so
casual.
Yeah, and my mom was like, why is Maddie crying? Like, what did you do? But I wasn't crying. I was fucking cracking up because I was so fucking blazed. And so I swear to God, like 2 weeks later, I have this memory of sitting at the fucking dining table with a shitload of weed on the counter, and it was like me, my brother, and my mom like fucking smoking weed, and I was like, what is my fucking life right now? So yeah, I had weed was like a family thing. Like my mom, she has trouble with her lungs and throat now, so she doesn't smoke she can't really smoke. But she, after that, she smoked regularly for years and years, and so it was like a family thing. We like fucking grew weed. There's this ridiculous story
Nice.
of because my dad, he knew, but like he didn't approve, but he like wasn't gonna, like, my parents are separated, all that shit. So there's this fucking crazy story of how we grew weed in our house. He didn't live there, so he's only there sometimes, but it was like this crowded ass basement with a bunch of shit in it. And so we put a fucking wardrobe in the back of this like area with a bunch of basement shit. And so you had to shimmy behind the fucking heater, the fucking like heater blower, what's the word, the fucking heat thing. You shimmied behind that, and if you did that, there was a little space that you could walk through the pile of like furniture and shit, and then you could open up a wardrobe that was like, full-size fucking wardrobe, and then inside was like a giant fucking light and a fucking gigantic weed plant that
oh my
took
God,
up the entire thing, like and it's like all the fucking sides are like covered in tin foil, so it's like reflective too, so it's just fully fucking that like the suitcase opening scene from fucking Pulp Fiction of like, oh,
it's glowing, yeah.
and he didn't look because he knew we were smoking weed and probably could guess we were growing it or some shit, because my mom's plant crazy too. So but he never fucking found it anyway. So that's a whole that's sort of where I am with weed. But I apologize for all the tangents, but
No, you're great.
basically, I smoked a shitload of weed in high school, um, and I, I like realized like I think it was bad for me, unfortunately, because I was also super depressed. I was in a traumatic household. I was like, I had gender dysphoria that I didn't know what it was. I had, I had trauma. I had, clinical depression and all this shit. And I think it was like, my biggest thing is that I dissociate. And I think it really, that's what it did, is I smoked regularly because it was dissociative. Um, so weirdly, when I realized I was trans and started transitioning, I think I gained a level of emotional connectedness that I had never had before because I was unable to. I was like forcefully repressing away a connection with my true
Right.
self because of my gender. And so when I started to transition, I basically was like, every time I smoked weed, I started getting crazy anxious. And this was all illegal. This was years before it was legalized. So it was never, I never knew what it was. And it was always, and so that's also was a huge component of it. But like, I smoked weed with one of my best friends one time and I was like, I don't know who the fuck you are. Like, I don't know how to
Mm.
interact with you. Just super, like, really, really intense social anxiety that I had never experienced before and was unable to like, and it was for a ton of reasons, like I said about the dissociation, but also like I was growing away from that friend. Like, he was a dude stoner friend that I had because I never thought about who I wanted to hang out with. Like, he was a good dude, but
Mm-hmm.
like not at all like the people I surround myself now, because the people I surround myself now are like me. He was just, you know, he was a cool dude, but like not like me at all. So
Mm-hmm.
that caused me to just quit cold turkey because it was like it was not fun to smoke weed. And I quit cold turkey and I basically quit other drugs too, just because like kind of stopped hanging out with those people, didn't have access to it, and didn't feel confident enough to do, especially psychoactive stuff. I didn't feel confident enough to
Mm.
like do something like that. It like a bad trick that comes from being anxious and like not, and I didn't feel confident enough to be like in a place where I could do that stuff. So I stopped smoking weed at about 19, stopped doing other stuff as well. And then also when I married, or when I started dating my current spouse, they're a chemist, and they just have
Nice.
yeah, but they're very much somebody who has a lot of anxiety about
Mm.
specifically like lab created stuff like Molly, like
Right.
anything that's like a powder, because you don't know. And even with testing, like there's some amount of risk, and they like basically they just have so much anxiety about that, and they're like, I don't know if I can like deal with the anxiety of not, like being afraid of you taking something that you don't know what it is and like having that stuff. And I was like, that's cool, because I don't actually care that much. Like, I hadn't done drugs in years, so now it's like sort of a multiple thing where it's like it's like, it's not like a imposed boundary, but it was something that was like, this, I don't know how I would, this is something we'd have to figure it out, and I don't know how I'd deal with it. And I was like, yeah, that's fine, because I don't really care about that kind of stuff. So anyway,
Yeah.
long story short, I haven't done any kinds of drugs other than alcohol in a long time. I'm very curious about weed again, especially now that it's legal, because I do think I could find something I would enjoy, and I do think I would enjoy it again. It's just I haven't taken the time, and I'm also like have that memory of like being so anxious every time I smoked. And so, but yeah, that's a thing I'd like
Yeah.
to get back into. But
Yeah, and that's something that people are talking about in the chat, like the advantage of the dispensary model and just
yep.
like being able to know what strain you're getting so that you can kind of think about, do I want to have a more dissociative experience, or do I want to have, like especially now with all of these weird synthetic versions of weed, like some of them really are just like, I think Delta 10 for example is
Right.
very low on psychoactive properties, so it's almost more
Hmm.
like what I thought CBD would be like before I first took CBD, because CBD is so non psychoactive, it feels like nothing.
Right.
Like, all you'll
Yeah.
notice really is if you're in pain in some way,
Right.
like taking a painkiller, you'll notice it go away if you pay attention to it. But other than that, it doesn't really calm you down psychologically. Whereas there's now, versions that can have a calming effect or have a creative effect that aren't as like couch lock, tripping
Right.
balls, which those were always my early
Right.
experiences with weed, especially with edibles before
Yes.
before we had that kind of transparency.
The worst experience I ever had with drugs in my whole life was just from weed. Multiple, actually. I've had 2 experiences, one of which was with edibles. That was like, it was actually with my mom. My mom made weed butter for the first time, didn't know what she was doing, and made insanely powerful fucking edibles. And so we both had an
Oh
edible, and then had an
no.
entire night where we just had a panic attack together. Like we started having a panic attack, and then we went our separate ways and had fun little panic attacks because we had no idea how fucking powerful the shit we were fucking with. And then another time I had the worst trip of my entire life, just because of like psychological stuff that was happening. Like I was having a manic episode and I hadn't smoked, and I smoked, and it like put me into this horrible cycle. So that's I think it's interesting that like weed has this. I think weed, if you're not, I personally think if you have like, especially with edibles, because they're so strong and you don't know like what you're getting into until like it's way too late. Like I'm not, and this isn't like to dissuade people from doing it, just that like it does.
Don't start with edibles. Don't
Right.
start with
Yes,
edibles,
that
for
is
sure.
that is the
Yeah,
biggest
it's a bad
thing.
sign.
But anyway.
But yeah.
I feel like it's important though that like what we're hitting upon is this idea. I think sometimes it can be hard to have these conversations just because there is so much stigma around drug use that like it's hard to actually talk about some of the negative
Yeah.
effects of like this stuff, because I feel like sometimes in these spaces, if you try to say, especially like people who are into psychedelic therapy and stuff like this, like
Right.
you try to say anything like that could be construed as negative about these modalities of like, I say modalities because I do think a lot of people use them as modalities for like trauma processing and
Right.
shit. Like, and so you try to say anything that could be first like seen as critical about them, and folks will, who are really heavy into this, their usage of this stuff, or like really believe in it, will kind of like jump up and be like, like kind of make it seem like you're stigmatizing it, when the reality is like literally any drug is going to have a side effect. It's like there's
Right.
no sort of like perfect thing where you just get all the benefits and there's never any like potential downsides to this. And so I do think there can be a danger in just letting people have access to like super potent mushrooms, for example, and not talk about like dosage, how to have a good trip, like the things you should be doing preparing to have a good trip. Because for example, like my cousin is schizophrenic, and so I have to be really careful with like not accidentally triggering that in myself. And that's exactly how you can trigger that shit if you go on too heavy of a trip. So a lot of that shit, I don't think there's I think it's good to have sort of a balanced conversation about this, which is what we're talking about, the informed consent model. Is
Right.
like, yeah, it's great to talk about the benefits of smoking weed or like doing shrooms on the weekend or whatever. Like that's super fun, or like people who are really into microdosing every day. But there is we got to also kind of be like honest that there are ways that this can go poorly, or you can accidentally like, not everyone needs to bring up their trauma, not everyone needs to like have that come up and like process that, because like what Maddie said too is like if she wasn't in a safe environment for those feelings to come up and like whatever, that can just be re-traumatizing. So
Right.
also think it's really important that we are having this conversation about like, yeah, these things have a lot of benefits and they certainly shouldn't be criminalized as they have for so long. But yeah, there seems to be almost a flattening of the discussion, as it's either like totally the worst thing ever, or like it's the best thing and there's no downsides to this ever.
Right.
You know?
Right. And there's
Oh,
sorry.
go on. No, go on.
And it's very telling. Like there's something going on with like having this overcorrection of like drug positivity instead of like drug neutrality. It's like we almost still
Yeah.
feel like we have to justify using substances in terms of
Right.
them having some kind of benefit. They'll make you a more effective person. They'll make you a better worker, you know? Like I think that's where it comes from, is this like idea that, you know, God forbid somebody does something just because it's fun and they want to try it, and that
Right.
itself being a good, or just being a thing that we radically accept unto itself.
Mm-hmm.
Kind of the same thing with sexual health, you know? It's
Right.
like we don't need to justify sexual pleasure because people are like have less depressive symptoms when they get railed or whatever. Like it's
Right.
just a thing
Right.
humans do. Humans fuck,
Yeah.
humans use substances, animals use substances too. Like,
Yeah.
you know, like animals get drunk off of like rotted like fruit. Like this is a thing that beings with consciousness take an interest in. And so let's just have an honest discussion about what that is. And that's where the harm reduction, I think, point of view comes from, is that this acceptance that people are going to use substances for a lot of different reasons. Let's
Yeah.
inform people about what they're potentially getting into. Um,
Yeah.
and and I think that's also like a really it's so funny, like Devin, a lot of the stuff you were just talking about with psychedelics potentially being traumatizing. It also reminds me of conversations that you and I have had about things like EMDR and brain
Yes.
spotting. Like
Yes.
those are, which for those who don't know, those are like trauma treatment methods that can be really re-traumatizing and heavy, and they're not always something that you want to do unless you're in a safe place to do that kind of work. And I think it's the same thing with substances. There's lots of ways to end up in altered mental states, and they're not all substances. And those things are both good and bad. They're a
Yeah.
mixed bag, you know, and sometimes there's the right moment for them, and sometimes it's not. And
Yeah.
that's up to each person and where they're at.
I think that
Right.
this
Like I think. Oh, sorry, Maddie. Go on.
I think that this is all all the things that we're just saying about this is all about informed consent, you know? Like
Right.
that's the thing. It's like your fucking weed dealer is not going to tell you the bad shit about weed. Like
Right.
he's not equipped or motivated to tell you about that shit. But and that doesn't necessarily mean that, you know, that what it means is that this shit needs to be legalized and decriminalized so that we can have these conversations, because now it is like you know it's just illegal and you can't have any conversations about it. It's the same thing we were talking about with Dare, where they're like they don't
Right.
actually tell you shit. They're just like, if you do a drug you're gonna die. And so it's like
Right.
Yeah.
you like you were saying, you thought weed was gonna fucking kill you, and then when you did start getting into, when you smoked weed and you're like, oh, this isn't bad, this like that is a situation where people get into. And I saw this, like I said, I was a stoner. I knew a lot of people that did a lot of drugs, and I also participated in the diag culture of like people that like a lot of homeless people that were in, and I met a lot of people. I met heroin addicts. I met a lot of people that were doing a lot of different drugs, and it's just like they didn't it always felt like, and this is a thing that I've heard about Dare, is like, well, if weed is fine, then like I guess all of it is
Right.
totally fine, which is like,
Right.
again, we're not advocating that this stuff should be unavailable, but it's like you should know the fucking risks. Like even with weed, like people should know that that edibles are fucking not dangerous in like gonna kill you way, but like dangerous in a like powerful psychedelic way. Like, and it's just not a thing that people
Totally.
know. And it's and that is part of informed consent. Like, you know, that is the kind of shit that people should be aware of. And that's the kind of shit that I feel like it's a lot easier to get those discussions. And I haven't been to a dispensary, but it feels like it's a lot easier, from what I've heard, to have those discussions with people in a dispensary, because it is like, it is legal, and there is like there's more fucking leeway to like have these more nuanced discussions, because you know, and it's all also still involved with like capitalism is still like controlling these and blah blah blah, but like
Right.
it's,
But there's at least lab tests and bud tenders who can kind of walk you through, this has this attribute,
Right.
this has that attribute.
right.
Yeah.
And
Yeah.
we were talking about Molly, we were talking about psychedelics as being like a therapeutic thing, and I saw some things in the chat. So, as somebody was saying, Molly is like and MDMA has been shown so much, because of the things I was talking about with my transition, to be so powerful with trauma, like for people with PTSD specifically, because like the whole thing is like your brain writes a memory in a certain way, and then you're like re-traumatizing yourself every time you think about that memory. That's like I'm not the professional here, but my my understanding of trauma is so much that that's how it works. And it's like every time you are remembering it, you're rewriting it and ingraining it more as a traumatic memory. And I'm sure acid, I've like done less stuff with psychedelics in this way, but like for me, Molly was very much like I was able to just fucking like rewrite the memories about being trans and my understanding about being trans, and basically in one night, because of the way that I was thinking about it when I was on this substance. And like I said, I have trauma, I have PTSD, and that would be so important to like. I really wish I could explore MDMA therapy with a therapist, and like but I don't trust the sources. Like I don't trust that I will know
Mm-hmm.
what is in it, and I don't, so, and I don't have access to that. I legitimately think that
Right.
a lot of I could make. I've been in therapy for fucking, since I was like probably like what, almost 15 years now. And I think that I could make so much fucking immediate strides in my therapy if I had access to like MDMA therapy, like just from having taken it in the past. But it doesn't exist, even though we know how helpful it is.
Yeah.
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 I think one thing that someone brought up in the chat, which I think is like relevant to this and important, is like talking about age of these things, because I think that like, there's just certain things we know, like if you start certain drugs from an earlier age, you might actually have like long-term consequences on your brain or body and things like that. But
Right.
I don't necessarily think that the answer here is to say, like, it's really like a gray area, because I don't think we know for a fact when you tell kids not to do something, they're going to do it. And so it's sort of a conversation of like, it seems like someone had a really good example of their teacher actually showed them to go to a website about all this information about drugs that saved them, because
Yeah.
when you tell kids just straight up, like, you cannot have this until this age, they're going to want to do it. And then if you're not giving them the same information, like a lot of kids aren't, they are small people, like
Yeah.
they are people. And so like if you give kids like the accurate information about it, a lot of kids will choose not to go take 5 milligrams of shrooms their first time. Like if they know the
Right.
real, honest, like downsides of these drugs, a lot of them will not do that. Some of them will, because it's like there's obviously always going to be someone who's going to want to go all the way to the extreme. But I also think um, it's really important to let kids know the realities of these things too, and to sort of be able to say like, hey, like, it may be worth it to wait until this age to really try this because of these things, and just have honest conversations about it, as opposed to just like, making it just sound like one big happy free for all with zero consequences ever.
Right. And and
Yeah.
and that's, that's the informed consent bit. And it's like, um and it's, prohibition doesn't work. Like we know this
Yeah.
in
Right.
every sense. It just doesn't work. And also, when those kids that are going to go and, like you said, do a shitload of shrooms their first time, you're not gonna prevent them from doing it through education. You're
Yeah.
And
Yeah.
then when they do something like that, or whatever it is, or that, or a harder drug, if it's fucking illegal, they can't get help, and they're gonna, if
Right.
it's
Right.
fucking, if they OD on fucking heroin, they're gonna die because there's not help, and it's
Right. Yeah. Yeah. Prohibition and the shame that's tied up in it, it messes things up on the production side, as we already kind of talked about, not knowing what you're getting, not being able to produce
Hmm.
things in a safer way. And then
yeah,
when people do take risks, the parallels between dare and how it does not work in the literature are an exact mirror to how abstinence only sex education doesn't work.
Right.
And I talk about both these things in my next book because they're just such perfect examples of how shame and saying that something is categorically a bad or dangerous thing rather than discussing here's what it does, here's what it doesn't do, here are the things that you need to think about when you are having sex or you are using this substance. When you don't have those open conversations, people basically avoid the thing that they've been taught is really scary for as long as they can, and then when they finally try it, it's in the most unsafe circumstance possible, and they have a bad experience, and they have no
Right.
recourse if something bad happens. And that's what we see in people's sexual wellness outcomes who go through abstinence only, and that's what we see through about kids who go through DARE when it comes to drugs.
Right. And I feel like it would also be remiss of us not to mention that we're all, like, as far as I know, we're all three white people having this conversation, right?
Right.
And so our relationship to these drugs and the fact that we can even sit here and have this conversation with each other is, I think,
Right.
in part because we haven't we haven't had our communities completely like just well, some of us, depending if you're in Appalachia, this is a different story, but
Yeah.
a lot of our communities haven't been at least been racially targeted with these things, with drugs, and have had our entire communities destroyed with this like direct intention to destroy them and thus like stigmatize drug use among and make it seem like it's just people of color, but specifically like Black people who are using these drugs and who are dangerous. And I think that's important to mention because it's there's two things, right? So we're talking about all the ways that these things like psychedelics or THC could actually be really beneficial. And I
Right.
think we are in part able to even talk about that because we're not necessarily worried about the people who are watching us right now being like making like dramatic assumptions about us because like Devin and I are sitting here with fucking PhDs and shit and we're all like
The
clearly like
respectability, yeah.
Right.
there's this respectability about it, right? And so it serves this multiple purpose where there would be a lot of really awesome trauma processing that could happen with people who are not white. But there's also this like double-edged sword where it's also doubly stigmatizing to use these things in those communities because it's seen as, you know, like such a negative thing because of this history. And yes,
Right.
someone mentioned Carl Hart. Dr. Carl Hart, who's at Columbia, does a lot of really incredible work about how it's not necessarily the drugs themselves that are have destroyed um, like Black communities historically, especially like crack cocaine and opioid epidemics and stuff like that. It's specifically the social context that these communities are kept in, and these drugs are quite literally like the only mental escape. It's
Right.
a coping
Right.
mechanism. And like, let's be clear, the US government flooded crack cocaine into these neighborhoods. Like
Right.
this is there's like a long history here that I
Yep.
think we should be talking about with drugs too and
Yeah.
harm
Yeah.
reduction.
Yeah.
And
I
that's kind of a perfect transition to one of the other things we were going to talk about, which is the Black Panthers kind of work.
Yeah.
But we can get
I'll
back
I'll
into
say just from my personal experiences, like I said, you know, I was a big stoner. I had all stoner friends, and I lived in a like mostly white place, but it was night and day the difference that I saw the way that like law enforcement interacted with my Black peers. And every single one of the people that I was like, the people of color, like not only Black but in general the people of color, like but especially Black people, were like just so immediately, you know, uh had so much harsher consequences and so repeatedly like were put through the justice system. And like it's just unreal, the racism that I experienced in a super liberal town. Like, I mean, you know, Ann Arbor is and it like no like known as, like, you know, there's hash bash, it's super liberal, and yet even there it was so fucking clear the just the way that, you know, my Black peers were fucking not like it's almost more like how many more chances that I got, like how many more fucking
Right.
second chances that I got, like how many more like discretionary decisions were made in my favor rather than
Right.
like than my black peers.
Yeah.
And again, this is a super affluent, like, liberal town. This and you know,
Right.
Yeah.
And I think the other thing too that is wild is white people are way more likely statistically to actually be using drugs.
yeah,
Like
right,
because white people are way more likely to be smoking weed, using cocaine, like any of these things. And kind of like what Devin was saying too, in terms of like how we see these things play out in harm reduction. Um, we tend to see that Black queer people are way more likely to use condoms, despite the fact that the way that like the statistics are portrayed, it makes it sound like these are like the most highly at risk people because of their behaviors. When in reality, when you go
Right.
down to it, these are some of the most sexually safe people, like who are taking some of these like most precautions when it comes to sex.
Right.
And you see the same thing with drugs, and it's just really interesting because yeah, the assumption is sort of this like white innocence with drug use, and like, oh, we can just give them another chance, or they're just
right,
being young and whatever. Whereas if a Black person's using these drugs, they're going to be criminalized and incarcerated for the exact same thing.
right,
Right. And even as we see weed getting legalized, just using Chicago and Illinois as a case example, weed gets legalized, these dispensaries open, every single dispensary that opens in the city is owned by a white person up
yeah.
until,
Same
even
here.
though and even, like with the city, having certain steps where basically, eventually kind of set a cap on who could get a license to kind of basically kind of affirmative action, kind of like make sure that some licenses were granted to black owned businesses. Obviously, that was like a pittance in terms of the difference that it made. And, the city of Evanston, immediately to the north, kind of passed a law when weed was legalized here, saying that a certain amount of weed sales proceeds would go towards reparations. And it was really just kind of a housing grant for people who had already lived in the city of Evanston for like 20 years. Those were the only people that would be eligible to get that housing grant. And all of this is just to say that even when we do make steps towards normalizing drug use, it's still white people who benefit. And even in states where it's legal, the amount of stigma, let's say, that you face opening up to a medical provider about the fact that you smoke
Right.
weed as a black patient, it doesn't really matter, even though it's legal here and destigmatized for certain
Right.
populations, those barriers to getting, quality healthcare access because you don't feel safe being honest because you're going to be treated completely differently and scrutinized and punished and lectured for it. Like those things are still so much on the table. In
And
addition to
Right.
the
employment and
economic stuff.
employment stuff too is that
Hmm.
same exact thing.
Right. Right. Yeah. Even though it's legal here and in most places where it is legal, it's still usually fine for companies to drug test you and fire you.
Right.
And that also is going to often tracks with a lot of socioeconomic inequities in terms of who gets tested, who doesn't, which industries get tested and which don't, and things
Yeah.
like that. So
Yeah,
Right.
both that socioeconomic stuff that is like, black people and people of color have been discriminated against the entirety of the US history. And so, are more likely to be in lower socioeconomic groups, but then also like that the like more direct racism of the way especially black people are seen to be more like aggressive and all that kind of shit is like, well, yeah, and so what that means is they're, you know employers are more likely to take punitive action, and those punitive actions are way super likely to use weed as a scapegoat, which is same shit that cops do.
exactly,
It's all the same shit.
exactly, it all snowballs. And I see spirits our tryhards mentioned that even in a legal state, disclosing to a psychiatrist that they used marijuana regularly got them in their patient profile marked as having a marijuana use disorder.
Jesus
Where it's like if
Christ.
you were on a psychiatric drug that your psychiatrist had prescribed you and you were using that every day, that wouldn't be a substance use disorder, right? Like even if you were chemically
Yeah.
dependent on it, as many prescription pharmaceuticals are, right? Like you can't stop taking them, you know, um, willy
Yeah, I
nilly.
have a friend who has to get drug tested in order for his insurance to cover his ADHD medication. Like
Yeah.
he
Jesus.
can't use weed and have his insurance cover his Adderall because it will, even though THC tends to be one of the best things you can use to kind of counteract some of the worst effects of the stimulants, right? Like the
Right.
hunger, you don't have hunger, super amped up and whatever. And oftentimes, if you're able to use like an indica or some sort of THC like that, that can actually really help manage those side effects. But yeah, he like a lot of insurance companies, it's kind of like their version of the war on drugs is like stimulants specifically. I know you write about that in your I know you write about the overprescription of stimulants in your essay, Devin, about
Yeah.
it doesn't matter if you have ADHD or not, stimulants are going to do a thing for your brain. Like it will, yeah, and like it's uh like I take low doses ADHD, or sorry, I take doses of Adderall, like 5 milligrams, like very small, and like that 5 milligrams will help me uh get through monotonous tasks that I have a really hard time focusing on, like answering a bunch of emails or grading or stuff like that. Like it's really can be difficult for me to like get my brain to hone in and focus on that shit sometimes if it's not in the mood. I'll be like, well, I have to put these fucking grades in today. So
Yeah.
like I this is what I have. And so it is that sort of again like this informed consent model where I probably wouldn't, I don't think I have ADHD proper. Like, I don't think I would pass an assessment for it. Probably not. But I really benefit from using that drug in small doses. And that's why I was like kind of talking about this earlier in our chat too. Is like, I saw someone mention that they never thought about the difference between like medicine versus drugs.
Yeah.
I almost want to go zoom back and say, I really think we shouldn't be saying drugs versus medicine. I
Right.
think that
Substances.
should not fuck the verses. In fact, it should just be drugs, period. Like drugs. And I'm
Yeah.
including prescription drugs and
Caffeine.
mushrooms and acid,
Nicotine. Yeah.
caffeine,
And alcohol. I mean, there's
right,
Oh.
and alcohol. All of these things are drugs, right? And so I think it's actually more helpful when we think about in this sort of informed consent model, and this is like the reason why it should all be legalized is you get a real honest idea of the pros and cons of whatever it is. You have a specific issue that you would like to address, whether it be you need spironolactone for some sort of like for me, I have it for nalactone for hormonal acne. Someone else may have it for some sort of transition reason. Like it shouldn't fucking if you may have you just have a reason you have a drug that's going to do a thing, and you should be informed about what it does and the contraindications for that. But in the same way, weed has really helped me with my anxiety. It's helped me focus on stuff. So has Adderall. And so
Mhm.
it's kind of like I think it would be so much easier for us to talk about drugs, not so much whether you can get it's gate kept by a pharmaceutical company or a doctor with a pad, but whether like what is it that you are struggling with, or like what is the issue, whether it be pain, like mental health shit, whatever. Here's your options, and then like here's the informed consent of what these things can and cannot do.
yeah.
Right.
I wanted to
Absolutely.
shout out that Mossy Rock for subscribing for tier
Yeah,
1
thank you for the
for
subscription.
3 months.
Yeah.
That's our first
Oh.
multiple
Yeah.
month
Wow.
subscription. So thank you
Wow.
so
you're
much.
getting this bullshit for a while.
You're fucking locked into this shit.
You're fucked now.
Thank you
You're locked
so
in
much.
here with me.
Yeah, we have emojis coming, which is very exciting. We'll like I said, we'll make sure we talk more about that at the end before we jump off. So and also so a couple things. Another one very serious side effect of alcohol is it makes me have to piss, so I have to go do Devin, you brought up that you guys wanted to talk about I forget the name of the book.
Yeah, body
Yeah.
and soul. Yeah. So
Right.
We'll dive into it while you.
Well, actually, what I
get
was
this
thinking
pissed.
is I want to save that. Let's save that because there were there's been so many good questions and like comments in the chat, and I want to make sure that we
Yeah.
like. It's hard to keep track of the chat, and I was like, let's take a second and answer some questions, or just like
Sure.
kind of interact with the like.
Yeah,
watch the chat for a minute, and then
we'll go into
also
that, yeah.
Also, I have a dumb before we transition away from the talking about drugs. I have a dumb thing to do in the middle. So
Okay,
I'll
is it
let
the website?
it's the
Yeah.
website. Yeah. So we'll do. I'm gonna jump off for a sec if you guys want to start answering questions, and then we can answer some more when I get back and do that dumb thing.
Yeah, sure.
How do I?
Yeah.
I'm trying to find how to. There we go. Okay.
So wait, are we on the like hold thing right
No,
now?
no, no. You're good.
Okay.
I'm just
Okay.
turning off my camera is what I'm doing
Okay,
while
sweet.
I leave, and y'all are still on.
Someone asked about thoughts on the rapid increase of home psychedelic therapy on
Oh
Instagram,
yeah.
which
Yes.
I feel is like very related to your thoughts on like the proliferation of stimulants via like Instagram sponsored prescription
Yes.
services.
Yes, thank you. Oh my God, that was one I did want to circle back to. Oh my God. Yes.
Yeah.
This is so like so it's one of those things where it's like ADHD meds get really heavily advertised on TikTok, which is what you're alluding to also, Devin, and also ketamine therapy at home. Like all of these things are getting
Yes.
normalized. And it's a conversation where it's very binary a lot of the time, where people talk about either it's horrible that capitalism has
Hmm.
made people so unhappy that they need to take all these meds, or on the flip side,
Right.
you know, the like, oh, these things are
There's
wonderful and
no in
good.
between.
Right. And like
Yeah.
the for me it all comes down to pharmaceutical advertising is not
Oh
true
shit.
informed consent. Oh yeah, your
Yes.
camera disappeared for me for a
Sorry.
second.
I don't know why did it just. Sorry, my camera just flipped. 1 second.
Oh, no problem. Yeah, maybe
Well,
it just got tapped by your hand or something when you were taking a sip.
I think fuck man. Now I'm on Twitch. We're on so many different things that I'm having trouble remembering which app to press. Discord.
Oh
She's
yeah.
not a streamer. Okay, here we go.
Okay, you're back.
Sorry.
Okay. So no,
Wait,
you're
can
good.
you see me?
I can see you. Yeah, are you not on the let me check the
Oh, it's
stream to make
because it was delayed. I see it now.
Okay,
Sorry.
sweet. You're good. So yeah, so my thing is that like on the one hand, I think it's very good for people to have easier access to things like ketamine therapy. P.E. Muskowitz has a great article about this on Medium
Yeah.
called "A Good Drug for a Bad World" that I think really nails the nuance there, where we're not saying using any of these substances is bad. You know, I would never say like, oh, ADHD doesn't exist, everybody throw out your meds, it's just capitalism, right? It's not about that. It's
Right.
about people getting these individual solutions marketed to them by corporations that are not going to give you true informed consent and make you aware of all of the risks and benefits and circumstances where it would be better to use a substance versus not. They want you to use the substance and use it often, and they want lots of people to use it. And so they'll
This is
market
a
it.
for-profit motive.
Right, it's a profit motive. So, you know, like I am disturbed by those ads insofar as I'm disturbed by all ads, right? And I'm disturbed by the pharmaceutical industry being our way of accessing these things. That doesn't mean, you know, don't do ketamine. Like, you know, from what I've heard, like a lot of people get a lot of really great antidepressant effects from that, and MDMA and,
Right.
and shrooms have been so helpful for so many people. It's just really like we won't be able to have true informed consent until we start putting laws in place not allowing these companies to advertise. And yeah, I think that's a good place to start. There's a lot of other things we need to do, but you know, we
Uh,
need true
Right.
informed consent.
I
That
want to
means no
just make sense.
misinformation.
Seb, you said Maddie goes and it all explodes. I just want to make sure that was a joke. I'm assuming it was, but
No, it
just
did.
want to make sure
I
that
I
the chat can still hear us and everything's good. But
I fucked up and I flipped my camera on accident,
oh,
but we're
okay,
okay now.
okay.
Also, I'm also gonna do a bathroom break. I'll be
Oh yeah,
right
go
back.
for it.
Great.
I'll turn your video off. I don't know.
Yeah, we were just talking about the advertising of ADHD meds and psychedelic therapy online and on TikTok.
Yeah.
That Mossy Rock says informed consent has to go hand in hand with depathologizing transness and autism and all mental
Yeah.
illness. Oh
Yeah.
yes, a person after my own heart.
Yeah.
You know it. And that's the model, you know, informed consent is the model for accessing HRT that's more liberatory. And the only problem is that it's still treated through the medical system. Like our only
Right.
way of accessing it is through the medical system, which has its problems because it's not a illness.
Right.
But it's much better to be able to, as a patient, say, I am aware of, I've been informed of the risks, informed of the benefits, I've decided this is what I want to do, rather than the old model, which is you had to have a diagnosis of there being something wrong with you to be able to access HRT. So
Right. And I think
yeah.
that was it just last stream that we were talking, or recently, how we were just talking about like the whole medical and especially psychiatric system is so like it's based on false sort of axioms, right? And it's like it's all something that, like, not to say that there isn't a lot of good stuff there, and obviously both of you guys agree there's a lot of really important information in like psychology and all that stuff, but like the fundamental like power structure that is created is such like a really like creates some really pervasive like negative power structures, and like
Right.
ways
Yeah.
that professionals are educated and all that stuff, and it needs to be totally like
Yeah.
transformed.
Yeah, and that's what my next medium piece is all about, because one of our major HRT kind of informed consent clinics here in the city has just completely just been obliterated by layoffs and unions busting and shit. And so my next medium piece this month is all about like how, because we are still beholden to authority figures in medicine, we don't have true informed consent when it comes to HRT. Because if you say or ask the wrong thing, or like you never know if you're going to suddenly be deemed incompetent to consent to your own care. Like
Yeah.
you can't really,
Right.
if it's not a patient-driven care.
My
But
endocrinologist that I started with, um he he's like a fucking creep. Like, this is a thing. He was vaguely creepy to me. I have a pretty high tolerance for creepiness. Like, I think he like said something about Marilyn Monroe, like comparing like an ideal, like what I would be going for, like compared to Marilyn Monroe or something, which is like a weird fucking
Ugh.
thing. Um, and like I got weird vibes, but like I said, I have a high tolerance for that. But like I learned, like, from other trans people, even my fucking, like, it's so well known in the area that this guy is a fucking weirdo creep, that like my primary care physician was like, yeah, he's a creep, I'm aware of this. And
missing stare fucking.com.
yeah, so he's like,
Yeah.
and like literally every time I saw him, he had people in the room with him, because I think they know that, and they have to fucking babysit him to not say weird creepy shit.
Awful.
But it's like he's one of the few people in the area that like does this kind of care. And so it's like it's
Right.
so impossible to like find other people to see, or and it's probably different now. Find other people to see, and like they haven't gotten rid of him because there's not other people to replace him, probably. So
Right. Yeah. So while we still have time to like dive into special interest land, I think we should probably pivot to me and Devon's emerging new special interest of the moment, which is learning about like the Black Panthers healthcare
yes,
advocacy in the 60s, like this whole world of history that I did not even realize existed. I of course knew that they did like giving out meals and like a lot of community, like community services, but I had no idea the scale and the scope and the style of the healthcare work that they were doing until, Devon, you started posting about how we talk a lot about ACT UP as a harm reduction strategy, but there's so much that
Right.
predated that, and that was the blueprint. So I don't know if you want to dive into it a little bit too, or if you've been
Yeah.
reading up on it.
Yeah. So you definitely read a different book than I did. So I'm glad you did, because I'm gonna read, that's like next up on my list. But like I was reading a book called A Taste of Power by Elaine Brown, who was Huey Newton and Bobby Seale founded the Black Panthers, and Elaine Brown was she was in leadership of the Black Panthers, and she was also like Huey Newton's lover and partner. He was non-monogamous. And one of them, and her perspective, like there's a lot of like, you know, she's just one person. There's like controversies around her too, but she just spoke a lot about the Black Panthers work specifically around sickle cell, and that is something that disproportionately affects Black individuals, and there's a reason for that. As I think Devin, I think you posted about it, but
Yeah, yeah. It helps
do you
protect you
want to
from
say
malaria.
why?
Yeah, yeah. So
Yeah,
if you live in an area where there's a lot of malaria, you can't get infected as easily if you have sickle cell red, which is just a shape of your red blood cell type. And so a lot of people in Africa historically have not, are more likely to have sickle cell anemia because it's protected. Yeah.
it's protective, and so but essentially it can have other health consequences, and it was being largely overlooked, especially by the US medical system. And so the Black Panthers, well, first of all, they organized free community clinics. That was one thing they had, was like actual community clinics with doctors who were providing free healthcare to the community. But through those clinics, they were providing free sickle cell testing and treatment. And because of the ways in which they demonstrated such a need for this like research on sickle cell, and like on both prevention and treatment and all this other stuff via their work of the public uh, clinics, they kind of forced the US federal government's hand to actually start funding this research and approving medications for it. And this happened a good 20 years before ACT UP came along and did something very similar with the FDA for approvals of ARV for HIV. And so that just fucking blew my mind, because I've been in HIV work for a long time, so I've heard about ACT UP like quite a bit, and never once in like that sort of history had I ever heard of anyone else doing something similar. In fact, when I learned about it, people would often reference it as like this one example, like the only true example that existed of organizing for public health outcomes and structural change in regards to public health. I'd only ever heard people mention ACT UP. And so I was just genuinely like, well, fuck, this seems like feels very intentional, that when we, especially now in the era of COVID, you know, people will talk about ACT UP in relationship to COVID all the time, but I have not seen people talking about the Black Panthers in relationship to COVID, when in reality, the Black Panthers probably had one of the better models for something like COVID, because they were really coming at like a larger, like, we need universal health care, right? Like that was
Right.
their big thing, was like, we
Yes.
need free universal health care and prevention, whatever. So
And they
that
said
was
it for
my
all black and oppressed people were what their clinics were for. So they were doing the solidarity
right.
shit right from the jump too.
Right.
Yes, I meant to mention that earlier when we were talking about drugs, because I was going to say too, like, one thing I think that's really important is, yes, like Black and Brown communities are disproportionately affected by things like having the government introduce crack into their neighborhoods and things like that. But the government has also did something similar with opioids in poor communities that are
Mhm.
mostly majority rural white communities. And something that I found really fucking cool that the Black Panthers did, which I think modern day sort of social justice efforts will struggle with, is, oh, hi, sorry, I can hear my cat meowing. um, they struggle with this like this solidarity across like issues, essentially. And so the Black
Mhm.
Panthers, in order to become a Black Panther, you had to go through this really intense political education. Like, you had to read something like 50 books. You had to read about Marxism, you had to read about Leninism. Like, you had to have this really, really informed political thought in order to even become a Panther. And so that was what was driving a lot of their ideas around like having access to healthcare for people, like not like Black communities and oppressed people overall, because the thought was, we do like the Black Panthers were a lot of them were coming from lower socioeconomic means, and there was solidarity to be found among poor immigrant communities, poor whites. Like there was solidarity in which the policies and structural changes that they were calling for were going to be beneficial for all of these groups, or there was something to be had by all these groups. But the
And
tricky part with this was a lot of those groups, once their immediate interests were served, would kind of be like, oh, okay, maybe we'll like back
Right.
off now once we need to focus more
Right.
on the Black part of this, right?
right.
So,
Yeah, they
there's
didn't
really
extend it back in
understandable.
return.
No.
Right.
But also I think it's important to remember that like I think a lot of the because I think that's so accurate about that, and it's something that Devon, me and Devon have talked a lot about on the stream, of just like this idea of like this online discourse thing where it's like like putting ourselves into smaller and smaller and smaller subgroups, which has its benefits
Right.
for like identity and understanding yourself and all that stuff, like, but also
Right.
it doesn't allow us to have solidarity between different marginalized groups. I mean, that's why we did this. That was one thing, like on a microcosm of why we were talking about ADHD versus autism, and like how they're so similar, and how it's like it's more important to find solidarity in ways we can work together. And I think that it's important to remember that I think a big part of that is that they killed the Black Panthers. Like there was a concerted effort by the federal government, the CIA and the FBI to kill all of the leaders of that movement, to infiltrate and like
Arrest them.
arrest them, but also infiltrate and make
Suicide baited them.
right, and make
Yep.
just make their work harder. And and not only the Black Panthers, but any leftist group of that time, there was a concerted effort to that there was a war fought in this country against socialism and any kind of collectivism, and I really truly think that the echoes of that can still be felt in the leftist community now, and that is so a big part of why it is so hard for us to like find solidarity between groups.
Yeah,
Because of
no, you're totally right.
yeah.
Because one thing I learned from the book I was reading was the Black Panthers had a lot of money coming from wealthy white LA people, like producers, actors, things like that. And one thing they
Corporations
did,
donated a lot of things. Like it was surprisingly.
yeah. And like the CIA was like, well, we gotta do something about that, and ended up using the LA propaganda machine to like create this rumor that this wealthy white actress was having a baby by a Black Panther. And it caused a lot of anger on the Black Panthers side, because they were like, how dare, like, not all Black Panthers thought this way, but a lot of Black Panthers were like, how dare you be sleeping with this white woman? And then it caused a lot of grief on her side, where everyone was like, how are you sleeping with a Black Panther and giving them all this money? And they really were able to create this rift in structural support to the Black Panthers by just sort of like harping on those sort of difficulties in this work that are related to identity. And the last thing I'll say about this is, at the end of that book, Elaine Brown was in charge of the Black Panthers while Huey Newton was exiled in Cuba, and then he came back. And let's be clear, the Black Panthers, a lot of them were incredibly misogynistic. That ultimately, like, the US government and CIA was able to essentially manipulate that part, because any of the leaders who actually did have more progressive views on gender and sexuality and all these things, they were killed. Like Fred Hampton had really progressive views on cross-racial solidarity and gender. Huey Newton was actually like pretty, like, he was cool with gay people and believed, like, to some extent women should kind of be equal, but he wasn't very good at the enactment of that. And that's why Elaine Brown left, because Huey Newton refused to stand when Huey Newton got back from Cuba. He refused to stand up for Elaine Brown and the other women in the Black Panthers who were being disproportionately punished and things, for while like Huey Newton, secondhand man and stuff, could get like drunk and fuck up outside all he wanted and wouldn't be punished. And like, long story short, there was huge inequities in the ways women who were in the Black Panthers were being treated. And that ultimately was a weakness that the US government was able to exploit, and that was among the reasons that also killed it.
Right. Yeah. They're in the history of the Black Panthers and the work they did. It's such an object lesson of like the ability for solidarity to go right and then times for it to fall apart.
Yep.
And another example of that is that in a lot of their health clinics, again, they had a lot of medical supplies donated to them, even from like large corporations, which was really surprising for me to hear with
Yeah, I
the
didn't know that.
political legacy and association that they have now. It's like hard to imagine, Xerox, which was like one of the companies, like giving a bunch of like medical supplies to like the Black Panthers.
Mm-hmm.
But so they had a lot of volunteer doctors as well, but because those doctors were majority white, just because there's just more people with access to med school who are white, they were very intentional about upending the power structure. So if you were a volunteer doctor at a Black Panther clinic, you had to sit in on those same political education classes. You couldn't just be there to dispense services to people as if it were charity. You had to be a
Right.
part of the movement, and you weren't allowed to wear a white coat in most cases at a lot of clinics. They didn't want those symbols of authority. You were expected to pass on your knowledge as best you could. So teach Panthers how to like read sickle cell screening tests, teach people how to do their own pap smears on their own bodies.
Mm-hmm.
As much as you could pass on medical knowledge so that it was in the hands of the people, you had to do that. And then finally, if a volunteer doctor was condescending or rude to the patients they were serving, they were asked to go. So all of these things are such a strong contrast between how the medical system operates today and how
Right.
nonprofits operate today, even the ones that supposedly say that they're helping marginalized populations. It's
So,
always that framework of helping from above, right? It's not
Right.
a,
infused into the community.
a lot of that shit is so fucking basic, and yet it's so like, how many fucking years ago was that, and how radical are those kinds of ideas in the way that you know medicine operates now, and it's yeah,
Right.
it's
It brings me a lot of hope, though, that like this stuff has been done before. These
right.
things work. The only reason it failed was because it was targeted from like a billion different directions, right? Like
Hmm.
because the government was scared because it was working. So I
Right.
don't know. With all the fights that we have today and like the conversations that the Panthers were having were really really sophisticated, and a lot of issues they were more sophisticated than we are now. Like we've lost a lot of history because that
Yeah.
history was erased. So
Right. And I
yeah.
also think that, another thing that's only sped up, I think this sort of like digging in of sort of tribal wars of identities and stuff is the pandemic because people, rather than being able to have, I was speaking recently with a friend who does organizing, political organizing work in New York City, and one of the biggest leftist organizations here is called the People's Forum. Most of their stuff is in person. And I remember being like, why don't they do more virtual things? Like, why don't they have that level of like accessibility? And he made it clear. He's like, well, first of all, they all like everyone wears a mask. So there is like people are kind of in solidarity in that way. And second of all, they do that because you cannot beat the quality of an in-person interaction with another human. You are just able to sort of like, I know people I'm in science, so people get really annoyed when I get into my like kind of like spiritual shit that I've only very recently started getting into because I grew up in a very anti-spiritual, super science, no religion type of environment and household and then academia just further reinforce that. But I think like if you can kind of tap into the energies of people when you're in person, you can feel this sort of like dynamic with someone else, especially if you're having a more nuanced conversation. And it like Zoom and everything like that can be great. Like you can like even this conversation we're having right now is amazing, but we would probably even feel even better if we were in person having it, like it's really hard to beat the solidarity building that can take place when you're physically in person. And so because you stop like just reacting to people like Twitter, Instagram, all these things, you put out a thought and everyone just reacts immediately, and like most of them you don't have a relationship to. It feels like a personal attack, and some people do just do personal attacks because it's easy, because they don't know you, they're not talking to you to your face.
They treat you as a
And so
symbol of a belief system. Yeah.
right, and so it sucks because I think, there's so much that we as the United States people could have organized around in solidarity for our healthcare system as a whole. But so much of that conversation got lost because there are very valid critiques about ableism in the leftist movements because there's a lot of
Yeah.
ableism in these like organizing movements for sure. But then sometimes there were genuinely good questions being asked by leftist people about these things, and then they would get shot down really quickly because they're being ableist because the conversation is happening on Twitter as opposed to those in-person interactions can really like get deeper and not necessarily be so quick to shut someone down because we tend not to do that when we're talking to someone in real time in person.
Well, and
Yeah.
I think social media specifically is so much like those algorithms are specifically built to uh cause, they're built with like immorally, like they are built to increase engagement at all costs, which is like it's easier to get engagement when you're mad, and like we know this, we have like so much documentation, especially a lot of the stuff that I know is specifically from Facebook, where it's like they did experiments where it's like how
Yeah.
Without getting people's consent.
right.
I was gonna say without any informed consent,
Right.
you ask, yeah.
They deliberately manipulated people's emotions based on whether you saw more happy or more angry, anger-inducing things on your feed. Yeah.
Right. And that's not even, and those, that's just like immoral, or not immoral but amoral, like things that the way the algorithms are written. That doesn't even include the way that all of those corporations are in bed with like top leaders of political, the Republican, but the Democrat, like political power, and the way that those are in bed, and the way that law enforcement is like in bed with these tech corporations, and like so, and then the active psyops that are still, I mean, like they didn't stop fucking doing psyops in the fucking civil rights era. That shit still happens. So it's like all that shit is on top, or like on top of like active, like threats, and actively pushing these conversations into more like,
Right.
argumentative
Yeah.
spaces and less productive spaces.
Yeah, and I think that Mossy Rock, your comment about how in person does have a different vibe to it, but we do need to have accessible ways, to like keep people safe, and I think that's true. I think, but I think I don't know what Devin was kind of describing. It really tracked with my own experiences of being trans online only, and then moving into being trans and actually having community with people that I saw consistently, and I think that's where
Right.
that can happen online, right? You can have synchronous consistent interactions with the same people so that you're building community with them. Because when I was mostly just a trans person online, like before I was out, I had all of these ideas and all these fears about being problematic and saying the wrong thing, and like thinking a lot of things would be really contentious. And then once you go to like support groups and you see the same people every week, and in that case for me it was in person, but I think it could be done over Zoom or something like that, where you build relationships with actual people. People were not cutting people off for like identifying as a transsexual the way that like
Right.
online, if you use the wrong word
Yeah.
in the wrong context, like it's you just are descended upon. And I think that's just a really important part of like building real community, is having those kind of consistent relationships where somebody's gonna actually give you the benefit of the doubt once in a fucking while when you say things
Yeah.
imperfectly. And that's just how synchronous communication always works. Nobody says everything perfect all the time,
Right.
So,
No.
yeah.
Yeah, and I also think about like, yeah, even if COVID wasn't a thing, it's still going to be inaccessible to certain people. To get it like to
Right.
like this people's forum I'm talking about is in fucking Times Square. And for those of you who don't know, the New York City subway is extremely inaccessible if you don't if you're in like a wheelchair or you can't basically walk up and down stairs. It's only like very certain subways have elevators, and Times Square is one of them. But the question is, does the subway stop near you have it, right? And so to get there,
Mhm.
so there's always going to be these things. So yeah, I definitely agree. Like the in-person connecting is so important. But yeah, I do think there's ways and there should be priorities to be able to do this in real time, but in these sort of virtual spaces too, because like Devin was saying, like it's so important to be able to have the real-time conversation. And Devin also got like first Devin was trying to like explain to someone that Twitter is not the only place to get your social support, or like Twitter is
Or
actually
yeah,
in fact not the place.
to do
Yeah.
disability organizing. And
To
this person was like, yeah, they couldn't even fathom anything else. It was yeah.
Well, not even that, you were actively giving them actual tangible like thing, like support groups that were virtual, that were accessible to people with disabilities, that were not Twitter, that would provide this actual real-time interaction with people. And they just were not listening. I don't think they just refused to hear you.
No.
But you know, here I am in my clown makeup having an argument on Twitter about why you shouldn't use Twitter, you know. So
Yeah,
the
yeah,
fool,
yeah, yeah, yeah. No, exactly.
it's me, I'm the problem. But discourse annihilated. But yeah. So should we look at a bad weed website? Maybe?
Yeah, let's
Palate cleanse?
if we've I okay, so this before we get off that, what were the two books that you guys read? Because I'd love to put those in the chat.
Devin, you go first because I have to look up the author of mine.
Mine was A Taste of Power by Elaine Brown. And hold on, there's another one I want to recommend. It's something Young Lords, but I can't. I'm currently using my phone to do this, so let me Google it really quick.
Elaine Brown?
Yes.
Okay.
Yes, ma'am.
I wanted to put
okay.
the actual names in the chat so that we could people could copy and
Yes,
paste those
no.
into.
Thank you for doing that. The second book I would recommend is called The Young Lords by Johanna Johanna Fernandez. And
tell me
another,
that. Spell that out one more time for me. Sorry.
Sorry. No, you're fine. Johanna space Fernandez Fernandez.
I think I got that right.
And it's called The Young Lords. And it's also about in the 1960s, people in New York City specifically, because a lot of Black Panthers was more on the West Coast. Like obviously there was Black Panthers everywhere in New York City too. But they did quite a bit of organizing people of lower socioeconomic status, and particularly around healthcare. So that's one of my books that I'm reading next.
Yeah, and the one that I read, I just put it in the chat. It's Body and Soul, the Black Panther Party and the Fight Against Medical Discrimination by Alondra Nelson. And so that's another one that it's more of a history. So it's not, you know, voiced by someone who is a part of the movement. And so, you know, benefits and drawbacks to that, let's say. And this person now works for the Biden administration. So, you know, like grain of salt with everything.
Whoa.
Yeah.
This is
which I was surprised, but yeah.
More just what about the Black Panthers in general. A book that I read that had a lot of good stuff was or like the climate at the time from like a more specific spot is The Assassination of Fred Hampton, how the FBI and Chicago police murdered a Black Panther by Jeffrey Haas, I think that's pronounced. That was really good because it was like I really liked that because it was like a single story, and it talked a lot about the ways in which the police like on the ground were fucking with the Black Panthers and murdering people and all that stuff. So that was a good book, and the ways in which they were organizing.
Yeah, and they specifically killed Fred Hampton because they considered him the next great Black leader. Like they considered him the next MLK or Malcolm X. They could see it, and because he had that powerful of a solidarity building potential and power, like even at 21, he was doing that. And that is why
Yeah.
they killed him, because he was capable of building such strong solidarity of people for these movements.
Yeah.
You know, yeah, we talk a lot about the loss to queer history of so much of the
Yeah.
gay population dying to AIDS, but we don't talk as much, you know, just as we don't talk about the impact of the Black Panthers, the loss to progress and history from losing this many thinkers who they were
Yeah.
comparing, contrasting Maoism, Leninism. They were like taking their favorite elements of each of those things, like
Yep.
the non-elitism in doctors. That was a Maoist principle, and I'm not a big
Hmm.
fan of Maoism for a lot of other reasons, but that was a cool element of how healthcare was changed under Maoism. And and while we're talking about kind of COVID precautions, one thing that I did learn in that Body and Soul book that was really interesting to me was how the Black Panthers handled STI disclosure
Yeah.
in their community.
Mm-hmm.
And this idea that if you were in the party, you belonged to the party, and taking care of your body was important for yourself, but also for Black political liberation as a political goal. And so if you tested positive for an STI, you were put on something called the freeze list, and anybody else in the party could call up if they wanted to fuck you and find out if your name was on the freeze list, and find out you were currently on meds for STIs and that they weren't supposed to fuck you until you were off that list. And that is something that under, you know, like how we talk about, it's really anathema to think about, you know, under American like individualism, this idea of
Right.
like medical privacy and you having your own right to decide what happens to your body. And, you know, I, you know, love all of those things, but also like that is an example of a community really saying we're going to take the health of ourselves as a collective seriously, and view each person as responsible for the health of everybody else, and helping maintain, help other, you know, hold each other accountable. And that's just something, I don't know, it just comes to mind when I think about COVID and how different how differently that's actually played out. Yeah.
Let's look at a dumb weed website.
Yes.
So here, let's Charlie, you're really being helpful. Okay, I think that the best way is just gonna
You've been getting some really good cat moments while you've been.
Oh my god, she's so. Oh my god. Okay,
She was really just like putting her face in the screen for a little bit, like very provocative.
Yeah.
It was really cute.
Devon's. Can you see on my camera
Yeah.
pretty well? Okay.
Yes.
So this is giftcities.org. This website fucking kicks ass. This is where all of the weird little gifs on the hold screen everywhere else is from. I love this website. It randomly stopped working for a couple days, and I emailed there's an email on here, and I emailed it and was like, hey, I love this website and I'm using it for something, and it stopped working, and they fixed it within like 40 minutes. So they're
God,
very cool.
Based.
It's Internet
Wow.
Archive. Please give money to Internet Archive. So this is a gift search engine. So they took all of the like when GeoCities went down, they archived the entirety of what was still there in 2009, I think. And this is a search engine of every GIF that was in that archive. So
God.
this is just searching for weed, which is
Look at the Sopranos. Why are they in there?
where was
That's
that?
what
Did
you
you
watch.
see
Oh
that?
You're
yeah,
high.
yeah. I don't know.
That
Whack.
makes sense.
This
I mean, same.
this file is called Whack Weed Images. Unfortunately, I would just love to just browse this website on stream, but there's also a lot of porn in here, like hardcore porn in here, so I can't.
Damn.
I have to be careful.
What's the name of this website again?
Right? Yeah, giftcities.org. It's great. Also, God, webpage museum, something like that was also really helpful for inspiration, and they literally do have a big collection of 90s porn websites, which was incredible. But anyway, so this is a very good website. I was showing these two last night, all of these good weed gifts, and Devon, this channel's Devon, said, I am so. What did you say? Like, I'm so bad that I can't click Web of Weed now, and
Yes.
see where
Yeah.
that goes. And I was like,
Yes.
oh, bud, you can. All of these are links, and they go to the
Oh my
fucking
God.
web page that has the fucking GIF on it. So this is an extremely good website. It's geocities.com/miss420princess. Do you know what time
Oh
it
my
is?
God.
Do you know where your bong is? I do. It's 1:54 p.m. Cali time, and my bong is right here in front of me. I just smoked a bong load. I'm bored today and had a hair up my butt for a bit, so I did some work. But come on, people, I know you're stoned and all, but at least let me know if I've done a good job or not. Sign the guest book, please. All right, I put pictures of the chronic_princess, parentheses, meh, MEEH, smile, like equal smiley face up. So if you want to see me, take a look. So this is just a really good website. There's this GIF here that's
Everyone go sign the guest book.
I don't think you can. I
Like,
tried.
go flood them with guests. What? You can't?
Well,
Oh,
it's
no.
archived, so not everything works, unfortunately.
Oh,
So this is the
damn it.
I know. This is on the Wayback Machine Internet Archive. Fucking prayers up to Internet Archive. They're so fucking cool. But
So blessed.
so okay, wait, actually before we do that. So I was trying to click on some of these links. Web of Weed is a little doesn't lead anywhere. Stoner Chicks Rule is a link that is a web group on GeoCities that unfortunately did not work, which is a huge fucking shame. But when I went to this other snapshot, this previous snapshot, there's this very good picture that said 31% bitch, thespark.com.
Oh my God.
Which I was like,
So what's
what the
thespark.com?
fuck is this? And it's going to take me a minute. And so this is thespark.com. This is a capture on May the 8th, 1999. And it is really, really good. There's just a lot happening. Deliver the Dis is artificially intelligent Windows software that uses patented feelings hurtation algorithm that we spent years perfecting on each other. Plus, it's an amazing copy to clipboard technology, so pasting insults into your emails, presentations, resume, all kinds of fucking weird shit on this website.
So you just click on that link and it makes an insult that then you paste into email?
Yes.
That's what it's designed for?
So there's a
Oh my
bunch of
God.
shit, but that picture specifically, the 31% bitch, is they have a bunch of fucking personality tests.
Oh my God, yes.
So,
Oh my God.
they also
the
have
gay test.
Yeah, they also have Burn Maker turns your text into fiery ball of hate. Bone Easy.
It's the Typer Durden font.
Yeah, Bone Easy sex acquisition software. But anyway, there's all kinds of shit on this website. But I wanted us to do a test. I don't know how much time at least one of us has to do at least one of these tests as the guest.
See the ass test? What's the ass quiz?
The ass quiz. Yeah, what the fuck is that? So hopefully these links work. They take a while.
test3.thespark.com/ass-quiz.
They kind of... Okay. The ass quiz. Nature's most important creation, the human ass. We use it for protection, for love, to keep our pants up, and to guide donkeys across the earth. Ever wonder how you rate with this most exalted of bumpy things? Well, wonder no longer basically. Short quiz will measure your ass aptitudes in 3 crucial areas: confidence, experience, and
Oh my
booty
God.
exploration. And if you prove that you're a true ass master, I'll reward you with the greatest gift of all, a stunning picture of my pink cheeks. Okay, but Devon, guest Devon, you are the guest. You're gonna be the one that I think has to take one of these tests. So what do you?
It makes sense. It's only right.
Yeah. So what
Yes.
are you feeling? Can you read them?
I think. Oh wait, let me look at which I should be looking at Twitch stream. Correct?
Either one is fine. It's probably bigger on the
Yeah.
Twitch stream. It's just
Yeah.
slightly delayed.
The gay test, the stress test, Gender test, slut test, bastard test, bitch test.
Oh, let's do the pregnancy test.
Okay.
Perfect. I mean, how long could this one be, right?
The Spark.com's pregnancy test. Everyone here at the Spark has been pregnant at least once now, and really? And though we all enjoy the healthcare benefits, enough is enough. Time to share the knowledge. Having a baby is the biggest event in a teen or preteen girl's life. But maybe you're 20 or 30 and wondering if you can still have a healthy baby. It does. Oh, this is going to be so problematic. It doesn't matter.
Oh, no.
Many doctors and pregnant people have painfully labored to deliver the research and slimy babies required to ensure 100% accuracy. But don't.
Gender neutral language, though. Pregnant people.
That's true. In fucking. Oh, this is from. So each webpage is probably going to be different time. This is from March 2000.
Okay, pretty forward
Wow.
thinking, though.
Are actually no, I'm sorry. Yeah, this is from 2001. But don't worry, this is the kind of test you fail or pass. You can't study for this one. That fateful booty call a few months ago was really all the preparation you needed. And
Amazing.
And then the button says push push.
Wow. Ooh.
Oh, Chubby Kumquat. Yeah, no, I was here in like 2000 or 2001. Anybody else recognize this this website? God, I hope this works.
Yeah.
I
It might
do
just be
too.
real-
I hope it's not like archived.
Just seems like it's real chunky. Okay. Oh.
No, no.
Oh, no. It's just push push again.
Damn it.
No.
We tried.
The logo and web design reminds me of early Snopes so much.
Oh yeah,
The
absolutely.
lamp and the layout.
All right.
Yeah.
Unfortunately, here I'll try. I guess I'll try the most recent. I'll try one more time.
Why is it? It's taking you to community.sparknotes.com.
Oh yeah, that's right. Because SparkNotes. Okay, yeah. See, I forgot that the more recent.
Oh, the Spark became Spark Notes.
Yeah. So
Like,
I don't.
Are these related?
I don't know if they're related, but they bought the domain basically, I think.
Oh, okay.
So yeah, the newer ones are like redirect to SparkNotes webpage.
God, some of those boxes looked like MySpace profile boxes. Like the pale blue.
Go a couple more in the future, see if we can't. I'll just try one more time. No, I don't think it's gonna work.
The pregnancy test is not going to term.
Disappointing.
Yes.
Okay. Well, let's go back to the main page and see if we can get any of this. Oh, okay. Now this is a different day with different shit on it. All Easter Reverie by Ernie Morrison. Ernie Morrison is one of America's foremost Ernies and the poet laureate, air guitarist laureate of thespark.com. The Spark is proud to present his original and thoughtful meditations on coping with loss, friendship, Easter here for the first time. This is very cracked.
Yeah, what the fuck? Like, why?
Let's
The
try.
sex text one with the guy with the whip. Yep.
Let's try the slut test because that one has a bigger link. And I'm hoping.
Sluttist. No, slut test. Misreading the URL.
Slutist.
The sluttist.
All right, the slut test. We live in an appalling backwards world in which everyday college students learn with greater skill how to spell the word misogyny and accuse each other of being sexist. Spark, however, dreams of a world where a woman is a woman,
Oh boy.
equally free to guard her
man.
precious jewel or
It's
give up
ideology.
give up the goods like she's going out of business. The Spark slut test, like the greasy, congested man standing next to you at the bank, breathing heavily on your neck and peering downwards at your exposed cleavage, is ready to probe your innermost sanctums and expose your most forbidden desires. Give him a chance, he might reveal things about your sexuality even that you didn't even know. So give the creep at the fucking bus stop a chance.
Oh my
Talk to
god.
the weird doctor that you can't be left alone with. What's
So
the worst that could happen?
so ladies, come take this Spark slut test. It's guaranteed quick and easy. All right.
Okay.
Oh, I think it's not gonna work.
Well, let's see. Oh, Oh yeah, it seems like then it like just redirects back to the front
Yeah.
page. It seems like.
Shame.
Damn.
Well,
The knowledge has been lost to history.
yeah. No, what the fuck is this?
We're gonna get banned. No,
Oh
no
shit!
content on stream.
I forgot about that.
We're not allowed to show any feet. We can smoke weed, but we can't.
We can smoke weed but not show feet.
That's incredible.
Biden's America. Yeah.
So, anyway, I'd love to fuck with this shit more, except I have to be careful that we don't get banned for it.
This could be a recurring segment for us as well, for sure. It's just like, especially whenever we have a guest, making them go to like these awful old websites. And
I think literally I'm gonna have to turn my display off every time I click and then wait to see what's on the other end of the link before I like show the chat.
God, the old internet, the Wild West. I miss it.
The Wild West.
What? The Spark was... I think the Spark was the college humor arm of Spark Notes? That's crazy.
Yeah, that's what Chubby Kumquat said. That's wild. Yeah, it sounds like Chubby Kumquat, you and I are contemporaries for sure, just based on the experiences. So we're winding up on 4 o'clock, or well, my time, 5 o'clock y'all's time. So Maddie, do you want to talk about the emojis?
Yeah.
I know you wanted to talk about that before.
I just wanted to say that they're happening. Basically, y'all probably, if you watched our MFF stream, you definitely remember us talking about our mutual friend Minmo, who is a great artist, furry art specifically. Oh yeah, their toy house would be good. So, and yeah, they're gonna do some emojis for us. We're gonna start slow. We're gonna start with one like of each of our personas. We have a bunch of ideas.
Probably doing like iconic like Twitch emoji reactions. So I think we're gonna do Maddie's possum persona as doing the like Pogger's face, and or the Pog emoji, and then my dear Sona doing the Kappa emoji, or something like that.
That's so cute.
And I wanted...
Devon, have you ever thought what your persona would be?
Yes.
If you were gonna be an animal.
Honestly, probably a cat. I feel like that's obvious. That's like maybe like a basic thing to say, but I really like, I like to nap a lot. Like I really like feel deeply like a cat.
It's definitely a common one, but it's less common than you would think. It's definitely not. It's maybe not even.
We get
top
overstimulated like cats. Like you like touch me too much and I'm gonna freak out. Like very similar.
Minmo is a cat too, so.
Yeah. I mean, they're popular because they're, they're timeless.
Mm-hmm.
Like
timeless animals.
Yes.
So, but a big thing I wanted to say is thank you everybody for subscribing, because we want to pay our artists what they're worth. And so yeah, a lot of the money that is going to be coming, like that you guys are subscribed, like when you guys subscribe and when you guys donate on the PayPal, we want to start like basically put that money into emojis so that so yeah,
reinvesting in the arts basically.
Yeah, and
so,
and
yeah.
and our stream, being able to have fun ways to interact. So this isn't like a formal like goal, like we're not setting a formal goal right this second, but like I just wanted to tell people like please subscribe and all that shit so we can give it to a cool artist so you guys can use fucking cool ass emojis in chat basically.
Yeah, and so then there'll be kind of like kind of a reward in place, because right now people that are subscribing, it's just like you're just doing it because you're nice, which is great. It's kind of like the anime sickos. Their Patreon is like, if you give us $5, you'll have given us $5. That's just, there's no there's no reason, there's nothing you unlock, because like
Oh,
I'm all about making sure the content itself is free. You know,
Right.
like I don't like paywalling shit. So it's
yeah,
just
I don't
like
think
the-
we'll ever make actual content. What I'd like to do
No.
is make a bunch of subscriber tier emojis, and then eventually we unlock follower tier emojis. So basically, if you follow us at all, you get free emojis, which we can't
Yeah.
actually do right now. We have to like achieve certain shit, but we want to also have that eventually.
Yeah.
It's for it said that got a design consultation appointment for my fursona tomorrow. After
Oh,
asking you questions on
shit.
the MFF stream, gave me the confidence to move forward. Congratulations!
Please send us your fursona art
Yes!
once you have it.
Please.
We'll do a rate your fursona.
I love that.
Yeah. That's so cute. That's awesome.
Devon, thank you so much for coming on our stream. This has been like I think we got deeper in the weeds of some really fucking important shit than we have here, and I'm just it's been great. Thank you so much for coming on.
Yeah. It's been
Yeah.
amazing.
Thanks for having me. It was really fun talking to y'all about everything from we had a very impromptu sexual health segment for a good
Oh
hour.
yeah.
Yeah.
I mean, there was like how many other things that we talked about wanting to talk about, and we knew we weren't going to get to any of it, to all of it,
No.
but still.
Yeah.
We'll have to
But
have
it was just like, especially once people in the chat had questions about that stuff, it was
I
like,
know.
oh yeah,
Yeah.
let's get into it, you know?
Yeah, no, I'm glad we did. That was actually really fun. I loved that. I mean, I expected this to be fun regardless, but like that was I love talking about that shit.
Yeah.
And I
Well,
know you've talked about wanting to get into streaming yourself,
Yeah.
like with covering that
Yeah,
stuff. So
exactly. I know this is like a good like test run for what this is like. So I was like, oh, this is actually pretty cool. I love this.
yeah, you were
yeah, so
like
everybody give her a follow.
yeah,
Yeah.
you were literally like, I love yelling, like just yelling into a voice memo to Devon about all the things I'm mad about, and I'm like, just get on Twitch. That's why we have a Twitch channel, so we can yell about all the things that piss us off to our wonderful viewers.
No, I love it. It's so true. Well, let me know if you want me to come back to yell about some other shit, and I
Absolutely.
sure will.
I was gonna
Yes.
say that, and then
Do it again.
so there is a Nightbot that's been saying into the chat sometimes your Twitter and your Instagram. Let's see if I can get it to say it again.
Oh yeah. Yeah, thank you for putting
Oh,
that in,
thank
Maddie.
you.
Yeah.
I appreciate that. I didn't even realize you did that. Thank you. I actually, that's funny. I like went on Twitter and saw I had like new followers. I was like,
Oh,
and
cool.
they're all, but it's like specifically people, you know, who definitely have like some sort of neurodivergence like thing in their bio. I'm like, this has to be coming from the stream.
Yes.
this has to be coming from the stream right now.
So,
I love it.
so on Instagram you are Dr. Dr. period DVONP, and on Twitter Dr. _DVONP. Is there anything else that you want to plug before we let you go? Any other things?
That's those are my things. I guess stay tuned for Devin and I talking our shit in a scientific journal.
Fuck
Oh
yeah.
shit, yes.
You'll have to come
Yeah,
back on for
yeah.
that.
Yeah, Maddie, I just love that you asked that question because I'm not kidding you. I texted Devin. I was like, I want to do this because it is actually extremely relevant to like what you're writing about right now. But also, I'm really asking because I think it'd just be funny.
Yeah.
Right.
How can you make it? My question is, how can you make it more shitposty? Like, is there another unrelated Devon Price? Can you like? I'm thinking about that guy that would always include his cat as like a co-author.
As
Can
his
you?
co-author.
Oh my
Can you
god, that's incredible.
Can you find? Can you name one of your cats? One of your pets, Dr.
yeah,
Devon Price?
There's some basketball player that I always get Google alerts about with the
Oh
same name. So maybe
yeah.
I'll ask him if he
Yeah,
wants to
yeah.
just, sit in on a meeting. If he contributes a single
Yeah.
thought, then he's a co-author.
Fuck yeah.
Yeah. No, it'd be
yeah.
incredible. Yeah. You know, you gotta troll science where you can.
Fuck yeah.
Yes.
So yep,
Absolutely.
go follow the other Devon. We still
This
haven't
is getting out of hand. Now there are two of them.
still haven't
Who
figured.
knows? Who knows how many there'll be next?
They're
I know.
you guys
Oh my
are budding. Just
Yeah. That's so funny.
okay.
All right, well, thanks for having me, y'all. This is really fun. I
Yeah.
like this a lot.
All right.
Yeah.
We'll see you later,
Great.
chat.
Well,
Thank you guys
Yeah.
for hanging out. Oh, let's we always
yeah.
forget every single time. Let's
Yeah,
see if we can
rating.
find
Yeah,
a
let's see.
raid.
Oh, yes.
Yes, you know,
I
pass
need
on
to
those
have
eyeballs.
Anthony. Well, I was gonna say I should have Anthony raid the stream one time, but his stream ends at like 11 p.m. or 12 at night. So,
Oh yeah.
If you could
Yeah.
get Fantano to raid our stream, we'll stream at fucking midnight. If that shit,
okay, well, I can't like my.
his audience would be so not our
It-
audience, but I still would
I
fucking
No,
know.
it
do it
would be
because it'd be so
perfect.
funny.
Yeah, no,
Yeah.
I'm gonna have. I mean, my partner mods his stream, so I'm pretty sure I have some sway over the future. Let me know. We'll coordinate a raid.
Oh my god. Yes.
That would be very funny.
That'd be amazing.
Yeah.
Uh,
Okay, it looks like we have KD Jensen or Diva Panda. We
Yeah.
could raid KD Jensen playing Sonic the Hedgehog. That'd be cute.
that seems appropriate. All right.
Okay, I'm gonna hit it. Oh yeah, and they've got their persona model going, so
Fuck yeah.
that'll be cute.
Yes.
We need to
Yes.
we need to have some VTubers on. Okay.
Yes.
Say hi for
bye
us.
everyone. Thank you for being here.
Everybody.